please switch off your mobile phones or Blackberries. I've had apologies from Fergal McKenna. Any other apologies? No. A couple of items on the chairperson's business. Just want to reference the very useful, effective questioning training session that was held last Wednesday. We will be having a discussion on how to take forward some of the ideas and issues that were raised at that, and we're hoping to do that at a pre-meeting on the 26th of November, so people can reflect on that in advance. Also want to just inform members that the Transforming Your Care expert advisor had highlighted some information that she needed from the department in order to carry out her work on the benefits framework. Just want to advise members that given that the committee had, I suppose, quite a tight time frame and we didn't formally meet last week, I had given permission to the clerk to issue a letter to the department requesting the information. A copy of that letter is at page 7 of the meeting folder. So I'm asking now if members would formally agree to that request. Great. Thank you. Referring members to page 9 of the meeting folder for correspondence from the Committee for Finance and Personnel regarding the timeline for budget scrutiny. Again, just want to advise members that we are in a very tight timescale in and around the budget scrutiny and the timescales announced recently by the Executive in relation to consultation on the draft budget. The Committee's report on the review of Budget 15/16 needs to be brought forward to dovetail with the budget timeline. So that means that our committee would need to produce our findings by the 3rd of December 2014. Can I just advise members that an Assembly researcher will attend next week at our meeting to brief members on issues relating to the draft budget 15/16. That will then be followed by a briefing from the clerk providing an update on the evidence received to date as part of the committee's review of the department's approach to the budget. So can I seek agreement for that briefing to be held in closed session as it is part of our ongoing inquiry? Thank you. We will then receive a briefing from officials in open session on the draft budget allocation for the Department of Health. I want to refer members then to page 4 of the tabled meeting folder for correspondence from the clerk to the department, requesting that some specific issues to be addressed in the budget briefing paper on the 26th of November. Again, advising members that given the committee that we didn't meet formally last week, we did have a tight time frame for preparation. So again, I had given permission to the clerk to request that detail from the department. So I'm asking members now to formally just agree to that request.
Great.
Also, just want to advise members that an Assembly Christmas e-card is again available for electronic distribution, given financial pressures within the Assembly and the wider public sector. Committees are encouraged to use the e-card.
For Christmas? There is Christmas?
There is Christmas.
Oh, that's good.
I'm asking members then, are they content for the e-card to issue to stakeholders and for the chairperson to agree the distribution list?
Right.
Thank you. Item 3, members, is the draft minutes of the meeting of Wednesday the 5th of November, which is at page 22. Are members content to note?
Great.
Thank you. Item 4, members, is the independent inquiry into child sexual exploitation. I want to refer members firstly to page 5 of the tabled papers for the report itself on the independent inquiry into child sexual exploitation and an extract from the 2011 Bernardo's report on child sexual exploitation of children and young people. Also advising members that Professor Kathleen Marshall, Inquiry Chairperson, is here today and you're very welcome to brief members on the finding of the report. I'll just give our guests time to get seated. Professor Marshall, you're very welcome. And we also have Sheila Taylor as Inquiry Board Member and Glenn Houston from RQIA Chief Executive. I do want to say just that in the interests of time, and we want to facilitate as much focused discussion as possible, but I am asking members to keep their questions brief and to the point. and for officials to do likewise. So I'm handing over to yourself at this stage, Kathleen. You're very welcome.
Thank you very much, and I say I very much welcome this opportunity to engage with the committee about the findings of the independent inquiry. Could I just allow Glenn and Sheila to introduce themselves and to say what their background is?
Hi, my name is Glenn Houston. I'm currently the Chief Executive of the Regulation and Quality Improvement Authority. I have been there since 2009. I'm also a social worker by profession. I maintain my social work registration. I've worked in the service for 34 years, including 4 years as Chief Executive in the former Craigavon and Man Bridge Trust and 2 years as Director of Social Work in the Northern Trust.
And I'm Sheila Taylor. I currently manage the NWG network, which is 600 organisations across the UK tackling the issue of child sexual exploitation, and previously ran a project where we saw in the period of 3 years 554 cases of serious child sexual exploitation, and I've been trying to tackle this issue since 1999.
Thank you. So Glenn and Sheila are both members of the inquiry board, small inquiry board of six people. Well, as members will be aware, the inquiry was commissioned by the Ministers of Health, Social Services and Public Safety and the Minister of Justice in the wake of revelations in September 2013 relating to the alleged abuse of 22 children and young people. And subsequently, the Minister for Education joined the inquiry, and I think that has been a strength of it, that we have actually had a lot of cooperation and work from these departments together. This inquiry was one of 3 responses to those revelations. There is an ongoing PSNI investigation into the particular cases. There is a thematic review of the same 22 cases by the Safeguarding Board for Northern Ireland. This will involve a review of the files of the individual young people and identifying whether there are failings. It's about examining and evaluating. The independent inquiry into CSE in Northern Ireland that I was asked to lead last September was not focusing on the circumstances or responses to the young people who were part of this Operation Owl. We were specifically excluded from focusing on the 22 cases. Our approach was not about looking at individual cases and file reviews. In that respect, it's quite different from like the Rotherham type approach. In a short, we were asked to look at the nature of child sexual exploitation in Northern Ireland and a measure of its extent. And I have to say that right at the beginning, when this was set up, it was acknowledged, as it is across the UK, that because CSE has not been identified as a category and because data has not been collected, figures are not generally available. But in order to measure this, what was happening and a measure of the extent, the way we did that was we tried to get what figures were available to give us some guidance, but we also engaged very widely with parents, children, young people, agencies, beyond those that you would normally engage with, like, for example, the Education Inspectorate went into 20 post-primary schools, 4 special schools, and had clusters of professionals, the Education Welfare Service, the Child Support Service for schools, as well as children and young people. On the health side, we had a very specific focus and made particular meetings with school nurses and with the ambulance service, people who don't normally have a voice in this kind of engagement. And on the justice side, we had interviews with frontline workers, response, police officers, etc., right up to the higher levels in the organisation. So this was how we were trying to build up a picture of what was happening in Northern Ireland, using what figures were available, but fleshing it out with the insights and experiences of the people concerned. And I think, as you're aware, we involved, I think, 580 young people and 790 parents were involved altogether in the work that we did. We were also to examine the effectiveness of current cross-sectoral child safeguarding and protection arrangements and measures to prevent and tackle CSE, and this is where we were getting the insights from children, parents and frontline workers about what are the barriers to actually addressing this in an effective way. And although it wasn't the specific focus of the inquiry, we were asked to look at safeguarding protection issues for looked-after children who have been particularly vulnerable. As members will see from the inquiry's report, we engaged with a large number of individuals and agencies, and we had extensive work across the sectors and voluntary organisations and the communities. And a number of individuals also came forward, either submitted evidence or spoke directly to us. What we have added to the current knowledge base is a wider perspective from these frontline workers and their experiences of the strengths and weaknesses of the current system. These have helped us to identify some clear ways forward to make the response to CSE balanced, achievable and effective. So the inquiry consulted, as I said, 580 young people in total and 795 parents, and we think that represents a very broad spectrum. They weren't just from the care sector. They were children in school, they were children in organisations, and the parents as well. Parenting NI did an online survey as well as focus groups, and they had slightly different profiles and came up with some slightly different views. The key messages from the inquiry are that child sexual exploitation is not new, as we all know, but advances in communication technology have made it a much more significant threat to a greater number of children and young people. And people have told us that there has even been quite a change in the past 2 to 5 years in what is happening. And the greater number of children and young people who are now vulnerable also includes disabled children and young people. The parents used to feel they were better able to protect when they were out and about, but now in the confines of their own bedroom, for example, using social media, they can be vulnerable. So child sexual exploitation is a threat to all children and young people, not just those in care. The forms it takes in Northern Ireland are similar to those in other parts of the UK, but in each area of the UK it manifests at the sort of hard level in slightly different ways depending on the environment in which it is growing. And in Northern Ireland that has emerged in particular in relation to the legacy of the Troubles, and there's been a lot of publicity about that part of it. It is not possible to assess the extent of child sexual exploitation at the moment because the information is not held in a way that allows this. That was known when we started, it's known now, and some of our recommendations are aimed at trying to make sure that that changes. Over the past year, awareness of child sexual exploitation has increased in Northern Ireland and the response to it has improved. There are examples of excellent and dedicated work by a range of professional and voluntary organisations, as well as the beginnings of improvement in data collection. Much more remains to be done, but there are some good foundations for that future work. The themes from the recommendations: a need for awareness and cultural change, and we've said a public health campaign. It has to get through to everyone. Children and parents said they weren't aware of this and they wanted to know, and they made a very strong plea for that. They wanted to know about it in terms that made sense to them. And if you inform members of the public, you inform juries, for example. That was one of the big issues, that juries don't understand why young people go back to abusers or people who groom them. We want a balanced approach with an initial focus on awareness of child sexual exploitation, but moving towards integration with other keeping safe messages. We want to promote confidence in children, young people and parents to say no to exploitation and to report concerns. We want parents to be able to advise, support, protect and report, workers and carers to have confidence to exercise appropriate care and control and to report concerns, and communities and frontline workers to identify and report. We need a continued and reinforced commitment to improving relationships between police, young people and communities. That was a message that came through strongly. We also need a continued and reinforced commitment to improving the response of the criminal justice system to reports of child abuse and child sexual exploitation. We need a strategic approach. Good things are happening around the region, but they're not joined up. We need a regional strategy that links in with and builds upon related strategies such as trafficking, domestic violence, early intervention, drugs and alcohol. Health and education have to be recognised as significant partners in tackling child sexual exploitation, and the role of schools has to be acknowledged and resourced. We're very aware that the voluntary sector has a very particular role to play in Northern Ireland, and we feel that that should be recognised as equal partners. There are sometimes difficulties for statutory agencies in sharing information with voluntary agencies, and that can sometimes create mystery because voluntary agencies know things have happened but they don't get the feedback, and so there are sort of suggestions of cover-ups, etc. We want provision of safe spaces for young people at risk of or involved in CSE and services to help recovery. And critically, we think children, young people and parents need to be involved in the development of strategies and services. We believe that we have started some conversations through the work of this inquiry that have to continue to create services that are responsive to needs. So there's a large number of very detailed recommendations in the report, and we hope that once the initial publicity calms down, people will take the time to actually drill down into this and look at it and make sure that we actually have a joined-up, effective way of approaching this very difficult issue. So thank you, Chair, for the opportunity to make that opening statement, and we'll now be very happy to receive questions.
Thank you, Professor Marshall, for that. And begin by acknowledging the work that you all have played in this regard, and I think anybody's to be commended in advancing issues around child protection generally, and I think the committee would be in absolute agreement with that. I want to acknowledge that role that you have played. But I note, Professor Marshall, that we talk about in terms of the terms of reference for the inquiry. It was to establish the nature and extent of child sexual exploitation here in the North.
And the nature
what has it told us? I suppose my specific question is what has it told us about the extent?
It was about a measure of the extent in Northern Ireland was the terms of reference, the nature and the measure of the extent. It was always acknowledged, and this is acknowledged across the UK, that we don't know the exact extent until there is awareness, until there is confidence to report, until systems are in a position where reports are made, they are flagged up as CSE, there will not be that kind of hard information. In order to get a measure of the extent, we talked to people, as I say, in the schools and at the front line, and we had very strong statements, for example, for people in the education sector about how, in their experience, this was a growing problem and it was not restricted to children in care. And I think, while obviously some of the issues about the more high-profile issues that we have touched on in the inquiry are going to get initial response, if you think child sexual exploitation is restricted to organised gangs, paramilitaries and the army, child sex rings, you then think it's got nothing to do with you and your family and you can distance yourself from it. The issue that we have identified is that actually it is an issue for every family and every young person, and people have to be aware of that. And we got that strong information, particularly from we got it from the school sector, from the health sector, and from the justice sector. Okay,
so I suppose specifically, and I'm drilling down into this, but what it told us is there is a growing problem.
Yes.
So there is no detail really in relation to the extent or measuring the extent. Nature.
We have made, first of all, to the extent, we have put recommendations in the report about how we can measure the extent. And in terms of nature, I think what some of the things that we've highlighted that parents and children need to know about are things like the sexting in schools, which we're told is epidemic in schools, where young people are sending indecent images of themselves to other people, and then they're being passed around, etc., and they don't know what's happening. And parents weren't aware of this either. And young people, actually, some of the first groups of young people that I met about this, when I explained to them what was happening, some of them said they were angry that they didn't know about this, because they need to know about the dangers in order to protect themselves. And they were also adamant that parents needed to know. The young people were very clear themselves that their parents were the first line of defence. So if there is information that has been floating around in professional circles, it has not reached parents and young people. It has not reached frontline professionals, and they're the people that we've been speaking to, and they're the people that really need to know.
Okay, and this isn't a criticism of your work, Professor Marshall, but again, I'm going back to the question. In terms of the terms of reference to establish the nature and measure the extent, it hasn't told us anything in that regard. Is it a fair criticism to say that?
No, I don't think it is a fair criticism. I think we have garnered as much information as it is possible to do to build up a picture of child sexual exploitation. Could I pass on to my colleague Sheila, who wishes to say something about this?
I think it's really important here that people understand systems across the whole of the UK. The OCC inquiry found the same, and so did many other reports that the data has never been recorded. It's hidden under a whole range of crimes and abuse.
Sorry, and Sheila, I really don't want to interrupt you, but that's the very point that I'm trying to drill down to. The data issue, the collation and collection of data has not been dealt with. Therefore, there is a view there. There is a wider public opinion there that says this report doesn't really give us any more insight into the nature or extent because of those obstacles.
It obviously can't give you hard figures because of that, but I think we can tell you about what's endemic at schools and what people at the front line are meeting. Ambulance drivers, what their experiences of meeting young people, taxi drivers, what their experiences of the party houses, what young people say about it. So we're giving you as much information as we think is available, and we can't actually do any more than that.
No, I appreciate that honesty. Okay, and I want to move it on to the second part of the terms of reference,
Yes.
which was about examining how effective cross-sectoral child safeguarding and protection is.
Yes. Well, what we found there was that I have to say, in the past year, things have changed, and I think that was in response to the Operation Owl, etc. The health and people in the social care field have told us that whereas before there were quite a lot of difficulties in working with the police, and there still are, that the police have actually become more engaged with them in it. But what we have found is that people from other agencies who make referrals to each other, they don't get feedback, they don't know what's happening. Ambulance drivers said if they come across situations, they may think there is an issue, they don't know who to contact, and if they do contact somebody, they do not get a response that gives them the confidence to take it forward. So what we are saying is there has to be more coordination, and it's not actually something that's going to be a huge amount of expense. The times when young people are more critically at risk are out of business hours, when people find it most difficult to get an effective response. Now, there are out-of-hours social work services. The public protection units have told us that they do have people working out of hours. There are designated doctors. But what needs to happen is a joining up of that out of hours when young people are at their most vulnerable. And for an ambulance driver who's come across and has a very short time to interact with a young person, can contact somebody and say, look, I'm actually worried about this. What can I do about it? Where do I take it? And get a response that makes them feel confident to deal with it. These are the kinds of things that we've been dealing with. And as I say, we looked at it at the strategic level and at the operational level. And at the strategic level, Northern Ireland is a small place, but there's so many different organisations and partnerships. And I remember this before from my prior work in the Youth Justice Review, that people would tell you how many partnerships they were involved in. And it was actually quite difficult to get to do the day job. And I think there is a need, and people have actually acknowledged that there is a need to streamline it. Even trying to map it out, quite honestly, is a problem. We didn't come across a map of it. So we've made recommendations about that, and we've made recommendations about more effective interagency working. Can I pass to Glenn?
Yeah.
Thanks, Chair. I would just like to add a couple of comments. I think for me, one of the strengths of the process of the inquiry was bringing together pardon me, the social care, social services angle, education, health and justice. Take a drink of water.
We'll come back to you if you want to. Okay.
No, I have a bit of a cold, and I think that's what's affecting my voice. But as we went out to the front line and spoke to staff, I think what we heard most particularly coming across was a very strong message that where this worked best was where those professionals who had the knowledge, skills and expertise were working interactively, working together and working in a joined-up way. And we heard much of that around some of the structures that were put in place following Operation Owl. And we heard a plea for those kind of structures to be sustained and developed, because I think where those are sustained and developed, then the likelihood is that we will see better outcomes for children and young people.
Well, specifically then, given those issues or obstacles, I think, generally about society coming to terms with what is child sexual exploitation, and I suppose about the need to protect those who are most vulnerable. Would it have been more beneficial if your inquiry, Professor Marshall, had more power?
Well, can I tell you, there's different formats of inquiries, reviews, etc., can do different things, and they all have their strengths and weaknesses. And I know that was a particular concern of you, Chair, when this was actually set up. One of the things we found when we started going around to engage with agencies was that sometimes actually even using the word inquiry was putting people off. The very people that we needed to talk to on the front line often felt that it was actually rather daunting to make a submission to an inquiry, to give evidence to an inquiry, and yet they were the very people that we actually needed to hear from to get an idea of what was happening. I think we managed to overcome that, and it was quite a balance trying to have sort of the authority of an inquiry and making it clear that we were open and approachable, and that people who talked to us and who wanted to make submissions or come and speak to us didn't have to do a formal affidavit and weren't going to appear in an environment like this when they were questioned. They were anxious. So I would think that what we have done is one level which is critical to assessing what is happening and engaging people. If I had been asked to do a statutory inquiry with powers at the time when I was asked to do this, I'm not quite sure what I would have had to work on. I would think if there is a need for a statutory inquiry, it would be after our report has published and after the thematic review has published, when you've actually got some hard information and you know what you're inquiring into. So, and I'm not saying that that is a need, but I would say it's not. This was a different kind of thing. It has served a different purpose, and I feel we've come up with something that's helpful. But I wouldn't have said it's not an either-or. These are different processes.
Yeah, but how do you address the observation? And obviously, if it was an inquiry under the Inquiries Act, then you would be able to compel papers and compel witnesses, and there would have been a degree of accountability.
You're right in that. When you talk about accountability, if you want to have a situation where you are making very critical statements about an individual's performance particularly, you have to have that within an environment where they have legal protection as well. You have to have all the surrounding procedures. Now, sometimes that is appropriate. It's a very expensive and time-consuming event. You would not have got the results in a year like we have now. That's not to say that that might not be something that you would want to do at some point, but it's a different kind of creature from what we have done.
So, I suppose, leading on from that, if there are failings that have been identified across sections, departments, agencies, how does accountability kick in coming from this report?
You know, when you talk about accountability, again, I mean, we've made a couple of comments about things like that, about how there was an awareness in 2006, you know, after the Social Services Inspection report, and that when there was a commitment to gather information about children and young people going missing from care, that was done, but it wasn't analysed and fed into a strategy. There are some things that we've said about that, about the ways in which perhaps this issue could have been identified and addressed earlier. But we're not, as you said rightly, Chair, a public inquiry where we've got individuals there who are going to be named and shamed, if you like, and held to account. That is not the role of this. Our view is very much a forward-looking one. Our focus is on doing finding out what can be known about protecting children and young people. What are the dangers to them? What needs to happen to protect them, and having a way in which that can be taken forward. That has been our focus. So we have made comments about things like that, and we have made comments, you know, about interagency work, but not in that way that you're talking about, Chair, for you're absolutely correct that if you want to identify people like that, it has to be in a formal structure. It's a different process with different aims.
Okay. Well, just finally for me, and it's on a similar vein, but page 24 of your report talked about actually reports going back a number of years, and at a policy level, Include Youth had actually produced a piece of work at that stage, actually in 2001, out of the shadows, making a number of recommendations, which you said many of which are still pertinent. And we also see on page 13, again you made reference to this, 2006 report by Social Services Inspectorate. Again, you know, this issue highlighted. You know, what is your thoughts on your own analysis in this report that a number of these recommendations are still simply that, recommendations?
I think the thing is that the issue, although it's been recognised, it has not been given priority. It's been one of these things that's been kind of out at the sides, but priority has been given to other issues. And I think, my understanding of that is that, some of these things have been taken forward to a certain extent, but there hasn't been that focus on child sexual exploitation at those earlier stages. I think some of the stuff like the earlier explorations of child sexual exploitation tended to be talking about it in the terms that were used at the time, like commercial sexual exploitation and child prostitution, etc. And as time has gone on, both what is happening has changed and the way we have looked at it and discussed it has changed. So there are things that are relevant, and that's in line very much too with what people have been saying in the trusts, that it's not new, but it has changed a lot, and especially it has changed a lot in the past 2 to 5 years with the
Would you see just the point that you made there, that it wasn't given priority?
Yes.
Who's responsible for giving it priority?
Who is responsible for giving it priority? Well, the responsibility is, I suppose, the people at the time, the Social Services Inspectorate came out with it. I would imagine that the predecessors to the Health and Social Care Board, for example, would have maybe given it more priority. The Trust could maybe have given it more priority. But even now, people are... there is still a debate about it. We've had voices in Rotherham, for example, where they've had these very extreme cases there, where people saying that neglect is more important, drugs and alcohol are more important, etc. There are lots of priorities. What we have been saying is these are not competing priorities. All of these issues about neglect, about drugs and alcohol, about domestic violence and trafficking, which is more intrinsically linked, are also related to CSE. So there is always a question about where people put their priorities, and I think it wasn't really identified as an emerging priority, but I think the understanding of it, people were still thinking of it in terms of like a narrow model of, perhaps child prostitution, etc. And there wasn't perhaps a full understanding, but it could have been, I think, identified perhaps around about 2006 and taken forward then.
So it could have been identified as a priority?
I think it could have been, but it wasn't. It wasn't chosen as a priority at that time.
Is that not of concern?
I think, yes, in retrospect, that is of concern, and I think the fact that we haven't had, as I say, we've had the information about children going missing, and we had that's why we put the action plan at the back of the report, because people said they hadn't seen it. And so we thought, well, this is what it says, and it's been partly implemented. But what we'd said in the report about that was, yes, the data has been collected. It's still quite difficult to reconcile, and that has been acknowledged. It hasn't actually been analysed, and then the results of that analysis directed in a strategic way.
And I'm going to go back to the original point that I was making. If the information was there, if the information was flagged up, it was highlighted in a number of reports by 2006 by your own admission, you're saying it should have been a priority. Would then, at that stage, or at this stage, when your work kicked in, that full inquiry process not have been of more benefit? Because if it should have been a priority, then it was somebody's responsibility to take it forward.
Could I ask Sheila to...
I think the reality of the situation is that in 2006 there were a number of people who worked with child sexual exploitation on a daily basis that knew what it was like and how serious it was. But in reality, people have not got to grips with how serious the abuse is against children until this last couple of years. And it's been the focus of media, and that has turned attention to it. And I don't think Northern Ireland, in that case, is any different to anywhere else.
I'm not suggesting it is, but what I'm dealing with is the facts there, that it was flagged up in 2001, and it was flagged up in a 2006 Social Services Inspectorate report. It was then flagged up with a series of recommendations, 5, I think, in the Bernardo's report, which data went back to 2009. So the issue was clearly being flagged up. Whether we didn't fully understand it as a society, it was being flagged up. And by your own admission, you're saying 2006 should have been taken forward as a priority. Therefore, if there's failings in the system somewhere, then we need to hold each other to account. This is too important an issue to simply, in my view, you have a number of recommendations in a report.
Chair, I think that's a very important point. I've found my voice again, which I'm glad of. I think when you look at the strategy for dealing with children who are vulnerable, it's no, if you like, accident that it's called cooperating to safeguard children. And I think that very term cooperating suggests that the best results can be obtained when the organisations and the agencies that work in this very difficult and challenging area do collaborate and cooperate together. And I think what this report points way forward for is to set the frame of reference where that level and degree of collaboration and cooperation can be strengthened. And I think that's the huge message coming out of this. It's about going forward. It's about making sure that the systems that we have here will work effectively to prevent something like Rotherham or Rochdale happening in Northern Ireland.
But Glenn, with respect, somebody somewhere has to do that.
Yeah.
And, you know, when I'm hearing about increased cooperation protocols, of course.
Yeah.
But again, you know, I'm looking at the recommendations coming from the Bernardo's report, and recommendation 3 at that stage was about the board developing a fully resource targeted and action plan. You know, and the need for interagency work, and all of that was flagged up at that point.
Can I say, I think that actually leads to one of the things that we have highlighted in the report, which is that in Northern Ireland particularly, voluntary organisations have an absolutely critical role to play, but we think sometimes that's not recognised as equal partners. And I think that that is true, that reports like that perhaps aren't given the status that would be given to a report from a statutory side. And I think that we do have to pay more attention to what comes from the voluntary sector, and the voluntary sector have to be recognised as equal partners in this whole enterprise.
Okay, I'm going to move it on because I know there's a number of members want to get Kieran first.
Yeah, Chair, thanks very much, and thanks very much for your presentation and your report. I must admit I haven't got through it all, but I got the gist of it. You mentioned going forward. We want to all go forward as quickly as possible along the lines that you have recommended here. I don't know how quick that's going to be and how efficient it's going to be, but could you tell me, I have a couple of questions, how can the right balance be found by those responsible for vulnerable people between the provision of protection and allowing a degree of freedom for those young people? Yeah. I'm trying to, the balance. And is there anything that can be learned from an international scenery at all?
I think the thing is, and one of the things that we find people were saying is that, sometimes children's rights get in the way of protecting them. Mm. And coming from a children's rights background and feeling quite passionate about it myself, I know that that's not what the children's rights documents say. The children's rights documents say up to 18 you have a right to be protected. But the views of young people, especially as they get older, are critical to identifying the best way to protect them. Because once young people reach a certain stage, they've got practical autonomy, whether or not they've got legal autonomy. And we did have some quite interesting discussions with young people about that. People talk about what can residential care workers do if a young person is determined to leave the house. But when parents think about that, it's the same with them. What parents have is the relationship with a young person that you hope will dissuade them. Mm-hmm. And as one worker said, a parent can bar the door and say, I love you, and give you a hug. And so there is this bit about the relationship. But so I think it's acknowledging that young people as well will tell us what they need to protect them. We have to make sure that, first of all, that they know that they're being exploited, which is a critical issue because they often don't. And some of the young people that we spoke to gave us examples of how they felt people could protect them more. Yeah. So I wonder if Sheila wants to say anything about that.
I think it was quite sad to hear that young people actually only felt safe once they were in secure situations, and that shouldn't be right, really, in our society. The focus should be on the offenders and not the young people in quite the same way. And it seemed very strange that they could only say that they were safe, and that if they could stay in secure settings and just go out when they wanted to and come back and live there was quite poignant, really. there needs to be a real focus on what young people feel they need in order to be able to feel safe in society, and that will look different for a whole number of young people.
Yeah. Just to follow on from that, what support mechanisms should be in place for those young victims of sexual exploitation, especially bearing in mind that some victims may not appreciate what has been happening to them until they're adults? Is it a case that maybe we need to make some particular or extra investments in our mental health services to young people?
And yes, this is a point that's very close to my heart. If we just look at the Rotherham case where they talked about 1,400 young people over a 16-year period, what we do know about that is that they received very, very little therapeutic intervention to help them recover from that. So what we have here is a whole cohort of young people who've been very, very seriously raped and abused repeatedly, not just singularly, but repeatedly. And there has to be an investment in that therapeutic repair package that yet we're not seeing anybody invest in. So I think you have picked up a very key point.
That there's something there for the powers that be to invest more. Well, mental health and that has always been a way down there in priority. Just to go back to the international scene, have you any experience of what is done on the international scene in any continent?
Again.
Yeah, there's a number of projects. There's certainly one in Holland that's got a 20-year programme that they've been working with, and they've got a therapeutic repair package that has been scientifically validated and looks to be really quite robust for young people that they call trafficked, but it's the same as child sexual exploitation here. And Children of the Night in Los Angeles have got a very good programme of care as well. So I think we have got programmes from abroad that we can build from, because in reality there's very little anywhere in the UK that is that follow-up to young people once they've been traumatised through rape.
That's interesting.
Could I just add, Mr McCarthy, I think it would be remiss of us not to acknowledge some of the things that are happening here currently, and I think particularly the Safe Choices project run by Bernardo's is an example of a support mechanism which young people valued and spoke very positively about. I think for me, in some of the encounters that we had as part of the inquiry, going out, meeting with and talking to staff on the front line, the Rowan Centre, which is based in, as you know, in Antrim, is doing some excellent work with young people and providing support to them, as well as dealing with the issues that they need to deal with as part of the investigative process. So I think there are many examples of good solid practice going on here, but we certainly can look abroad and look widely and learn from that.
Right, okay, thanks, Chair.
Thank you, Kieran. And before I bring in the next speaker, and can just remind members, mobile phones must be near to microphones because it's picking up a lot of interference in the recording, so ask members to be mindful of that. Next, I have Fergal.
Thank you very much indeed, Chair, and I think you formally recorded me as absent at the start of the meeting, and I had written to you, but of course I appear. Thank you for your presentation. I reflected this in the Chamber yesterday about the extent to which your report acknowledges the gaps in information. You know, it says a lot about what we don't know. We don't know this, we don't know that, we don't know the character, we don't know the nature. Can you tell me, had Bernardo's been implemented, would we have known more?
If there had been the data collection, etc., had started then, yes, we would have known more. And I think that the sort of delay in recording data in a way that identifies CSE, you know, that could have been done earlier, and that hasn't happened. So I think, you know, some of the Bernardo's recommendations have sort of been partly implemented. But no, I think you're right, that if they had been fully implemented, we would have been further down the line now than we are.
So why did, at the outset, because this was reflected to you in public sessions here at the Health Committee, why did you accept those terms of reference and not look back to issues of why Bernardo's and other recommendations had not been brought forward?
I'm not sure that we didn't. I mean, if you look at the report all the way through, we reference the Bernardo's report as a starting point. And I think we acknowledge that, and we've questioned people on it, and we have taken it forward, but what we were doing was wider than what was in the Bernardo's report. So I'm not quite sure what the...
Well, can you tell me why you
Because-
weren't asking questions about action on data collection at earlier points?
Why we weren't... Well, we have been asking questions about data. Just people haven't done it, basically. So there have been delays in SBNI, for example, are working... it's one of their roles is to give guidance on data collection, and we have been in discussion about that. And there has been a delay in getting the data collection system going. And SBNI, who I'm sure you can talk to them about it as well, have been pointing out that they have to have the cooperation of partner agencies to do that. So we have actually talked about that, and we have actually made recommendations about data collection in the report. So we did take that on board, and we have questioned people about
Yes,
it.
but why haven't we got in the report more strongly reflected that action wasn't taken, which could have been helpful when that was pointed out at the time?
Can I make a
Yeah,
comment?
please do.
I think, Mr McKinney, one of the things that we heard through the lifetime of this inquiry were lots of challenging conversations about an acceptable definition of child sexual exploitation. When the inquiry began, there were a number of definitions of child sexual exploitation. The Safeguarding Board published, I believe it was in October this year, a definition for Northern Ireland. I think one of the real difficulties for health and social care organisations is how do you collect accurate information if you haven't got a definition as an agreed starting point? And I think that's a real challenge to the system.
But your report, as you're saying, acknowledges to some extent Bernardo's, and therefore it must acknowledge that action should have been taken earlier. Bernardo's was 3 years ago, and actually relied on information some years earlier. So we haven't got a picture because people haven't acted. Would you agree?
Yes, but I think that people, the question is whether people mandated to act on the back of that report. And whereas SBNI have been given a remit to get the data collection, because it wasn't a statutory report, I think people felt they weren't mandated. We have actually followed up specifically some of the data collection issues, and you'll see there's quite a lot in the report, for example, about following up on Michelle McIlveen's attempts to get information on the numbers of missing children.
Sorry, I just want to come in on this because
Yes.
I think this is an important point, and
Yes.
it's not your remit, but the report was commissioned
Yes.
by the department, and it was also launched and published by the department. So there were organisations and agencies mandated.
Can I ask you a question which I asked at the time? And in your estimation, how many children have been abused as a result of inaction, which was asked for years ago? Can you say?
We wouldn't know because...
Sorry. Wait,
No.
I'll let you finish. Sorry, the question.
Pardon?
I'll let you finish the question.
Yeah, yes, no, I don't see how we can possibly know that. And if
We could know that if there was a case file review and you went specifically through each case looking for the signs and symptoms and attributing them to child sexual exploitation. But that would be a huge job, and you'd have to go through.
Would you accept then, therefore, but would you accept that your report is about trying to limit the amount of people that are abused?
For the future.
for the future,
For the
it's
future.
protecting
Would you accept?
children.
Would you accept that the SBNI or the Bernardo's report was also similarly aimed?
I would accept that it would have a similar aim.
Would you accept, therefore, if there wasn't any action, that an X number of children were abused as a result of that inaction?
We can't identify that.
I didn't ask for a number.
No.
I'm saying, in a general direction, would children have found themselves abused as a result of that inaction?
As a result of not understanding the signs, symptoms, behaviour patterns of children that are sexually exploited by a wide range of professionals, there will be children that will have been exploited without doubt.
I
As
think
a
it's
result of inaction following reports
As a
focused
result
on
of
these issues.
not knowing what to look for.
Can I add to that?
Sorry. Bernardo's report did point in the direction of knowing what to look for. So can we assume that there were children who found themselves now abused as a result of inaction over previous reports?
I think, sorry, it's taken me time to sort of interpret what you're saying and try and reflect upon it, so I'm sorry if I'm delaying you. I think in any sense, when there has been a delay in tackling an issue and delay in having an action plan, that obviously means that there are some children who are going to be abused or lose protection that would have been protected if the safeguards had been put in earlier. So I think you're absolutely right in that. We can't put a number in that. I think, though, the question is now, we've come out and we have to make sure that this doesn't happen again, that what we're saying is actually acted upon. And whereas I think you're right, there's obviously this bit about looking at the past and what could we have done, the emphasis has to be on learning from that and saying, right, we haven't dealt with it head-on before, we've got to do it now, and that's very much the focus that we've been taking with this
yes, but that's,
report.
If you don't mind me saying so, and with respect, convenient for you and your report.
Why convenient?
However, yes, because you can reflect on this point forward and ignore the past. The children, however, would you agree, can't?
I think, Mr McKinney, it's important that we acknowledge and accept that there have always been systems and processes in place to deal with children and young people who are vulnerable or who are abused. And the great difficulty, I think, with the point that you make is that those systems and processes have been in place since 2006 and indeed well before. And there may well have been children and young people referred through the system who received support, who were placed on the Child Protection Register, who were part of social work caseloads, and would have received that support. The key question about this inquiry and its definition is around child sexual exploitation as an issue. And what do we understand about it? And I think we understand a lot more about it in 2014 than we did in 2006. I think we have now an agreed definition. That agreed definition going forward will be hugely important. If we were sitting here in 2 years' time and we couldn't tell you a number, then I think that would be unforgivable.
Since you've introduced that term, I think it's unforgivable, to be honest, that the Bernardo report and other reports weren't acted on at that time, and I think your report should have reflected that. Can I just touch on one more point, your indulgence, Chair? Why was the Rotherham and Rochester issue brought into this report?
Why was it or wasn't it?
Why was it?
It was brought in, well, we referred to Rotherham and Rochdale because there are other examples of, because we were looking to say, is it the same? We have said that there are some things that are the same across the UK and there are some things that are different. And what we were seeing here is that we've kind of been a wee bit wrongly quoted in this. You know, some of the reports that have come out have said that there is no evidence of organisation in Northern Ireland. We haven't actually said that. We have actually said there are levels of organisation in Northern Ireland. We have said there are some gangs involved in like trafficking and drugs. What we were saying, though, is that the primary model in Northern Ireland is not the same as it was in Rochdale and Rotherham. The primary model is more that there's young people down in the community who are being abused, and there are groups, sometimes not that much older than the young people and sometimes considerably older than the young people, who gather around a young person, who coalesce. Now, if that's not stopped in its tracks, some of these groups can become gangs, like the Rochdale and Rochester model. And I think we've got an opportunity in Northern Ireland to try and intervene and make sure that that doesn't happen, because we know what that dynamic is. I think Sheila's been more involved in the Rotherham issues.
I think what we actually picked that up from quite a number of people that we spoke to as well, where they said, this is not like Rochdale, it's not like Rotherham. That was the feedback from the people that we actually spoke to. But I would be concerned that we didn't take on board the fact that some of it is very organised, some of it is loosely organised, some of it is groups coming together, then become organised as they get into it. And you've got those individuals working, you've got a whole level of, whole different levels of organisation to this.
would you accept that by saying it's not as bad as, it might give the perception here locally that the problem isn't as
I
bad
don't think we
as?
said it
We
wasn't
didn't
as
actually
bad.
say that. What we said was people have told us, when we started talking to people, they said to us, it's not like Rochdale and Rotherham. TSNI said it wasn't organised. HSCB said it wasn't organised. The trusts were telling us it wasn't organised. And then we say, I think, nevertheless, the more we got down into the grassroots of the community side, the more we began to identify levels of organisation. So we are actually saying people can get confused too about organising. I've seen records of meetings where people talk about scenarios involving a number of young people and then come to the conclusion that it doesn't fit a particular definition of small-scale or large-scale organised abuse. That can actually be a red herring. There are levels of organisation. If you go to a house party, somebody's organising the alcohol, the drugs and even the taxis. So what we're saying is you shouldn't actually just pigeonhole it. Somebody described that to us as a seduction of labelling. As, you know, this is Rotherham Rochdale, this is not Rotherham Rochdale, this is organised abuse, this is not organised abuse. There are a number of levels of organisation. And people were talking to us in the terms of Rotherham and Rochdale, and we're saying there are some gangs, but that's not the primary model. There are levels of organisation in what's happening, and we have to intervene now to try and make sure that we can disrupt that and stop that from actually gaining a proper foothold in Northern Ireland.
I can understand the thinking, but I would put it to you that there is at least this potential out there in terms of perception that by saying it's not, then people might think the problem is
Yes, I
not,
think, and
that's a weakness.
Well, can I say that that was actually a concern that we discussed it, I picked up from the way some of it was reported, because I think you're absolutely right that that can lead to a complacency to say it's actually not us. And we didn't, in the report, we said there are some gangs, there are levels of organisation. It's not primarily, you know, like Rochdale and Rotherham, but if we don't actually act on it, you know, that will grow. We'll take more of a foothold in Northern Ireland.
Okay, thank you, Chair, for the time.
Thank you, Joanne.
Thank you, Chair. I've been that busy scribbling down comments, I could keep you here all day asking questions. Something that struck me, you did speak, Kathleen, about interviewing people who don't normally have a voice, and this was in reference to ambulance drivers,
yes.
I think, and I very much welcome this, but my fear is for so many of those vulnerable children who don't have a voice themselves and still don't. And you touched briefly on disabled children and how they were being vulnerable to social media in their own bedrooms. And it strikes me what can start out as bullying for those most vulnerable children in our society can then become exploitation. And already some of these children many of them are dealing with low self-confidence and self-worth. I deal with, as I'm sure other MLAs deal with, many parents who fear as their disabled children gets older that, in essence, that comfort blanket they've maybe had, the relationship with their special schools that they've had wonderful experience with, is gone. And for so many, when they turn 18, all they're doing is sitting in their bedroom feeling isolated. So can you maybe touch on this? Have you any more detail around that and what we can do to protect them?
Well, when people were talking as well about disability to us, they kind of used it in a general terms, a whole level of disability. And some of the particular concern that was expressed was those who had mild learning difficulties in particular that weren't diagnosed and didn't attract particular support. There have always been issues about the transition from disabled children from childhood to adulthood and adult services. And
that's a big bugbear of mine, considering the volume of parents that are...
Huge issue. And one of the things that we've recommended too is about the whole definition of vulnerable adult. We'd received a lot of comments from different sources about how the definition of vulnerable adult was too narrow to accommodate a lot of these young people. But towards the end of it, we discovered there actually is some work being done on that, and there's a new definition of adult at risk that is coming out. So I think the question for that will be, when this is coming out, to make sure that it is actually going to pick up and support young people who are vulnerable to CSE, because there is a whole, one of the recommendations too is that the Education Department should give guidance to schools in general about how they can support parents to learn more about this and how they can protect their children, but in particular how they can support the parents of disabled children, because they have childcare responsibilities. They don't find it easy to go to an evening session at a school. So we were looking at that as well, about trying to build up how you support parents. But it's very critical, and it's issues about as you say, young people are so vulnerable and they want to be normal, and somebody will come online and tell them, that they're beautiful, and will you, just send me a photograph and all that sort of thing. And one of the comments was that because people assume that young people with disabilities are not going to have a sexual life, they're not prepared for this sort of thing. That parents just cannot protect disabled young people to the extent that they were able to do in the past, and that's a very critical...
Alarmingly, parents that have contacted me and they're majoring on social isolation for their disabled, they haven't realised, they haven't raised sexual exploitation, so this is another deeply concerning issue that the parents haven't even realised that their children are vulnerable to. And that's something that certainly has alarmed me, because, there's so many details I've wrote down. You looked at the nature of child exploitation. It seems a more generic approach, and we need to delve more into the detail, because this is another, particularly around, I'm so concerned around disabled young people as well. How long do you envisage, as was described in this report, the journey, which the report refers to becoming action and practical help to protect our young people?
I think the awareness-raising thing, we know SPNI are already doing some of the awareness-raising issue, and we hope that's going to make an impact. We've heard, we did hear references to the material. We do think that there is a need for a much more wide awareness-raising is the first thing. If your parents of disabled children realise that this issue is there, they're going to be trying to do something about it, And one of the things we found in general was that parents weren't really aware of the dynamics of what was happening, and they want to be empowered and supported. So I think the awareness-raising thing is the very first step to doing that, because their parents will be able to do some things to protect their children. Did you want to say something?
No,
but with those fears that are going to be raised, they need to know there's practical help and guidance. Where they go and how they can address it. And
I think the schools are very willing to be involved in that. And as I say, I think that's one of the great strengths of the work, was the education, being involved to such an extent in this, and being significant stakeholders in it. Also, parents and children said, we don't want to put this in a way that scares children. It's actually quite a delicate balance. You don't want children to be suspicious of any relationship. There are some good things in life, So it is going to be a balance. So I think the schools will be doing something, but I think, I'd imagine, like when SBNI is doing its awareness-raising campaign, what we've thrown up here and has been identified both in disability organisations and in special schools, that there is a very particular issue there for the parents of disabled children that needs to be addressed, so they've at least got some guidance, perhaps in addition to what is there for parents generally. Can
I just add, I'd be very concerned if you were only looking at the transition into adult services for children with disabilities, because actually children that are sexually exploited continue to be exploited, and often are subjected to many other things like domestic violence and past 18. And what we see is services just shutting down at 18, and those young people being left. So whilst I see the importance of establishing something very concrete for disabled young people, it has to be for all young people sexually exploited, and that transition and support.
Totally agree. It was just Kathleen highlighted that one. I think it was just one sentence about disabled. Finally, Chair, if I may, the Minister detailed the pubs and clubs culture operating some areas where young girls or boys receive a tap on the shoulder and they're singled out to wait behind. I asked him to explain whether these clubs' details have been passed on to the PSNI for investigation. Now, I didn't get an answer to that. Can you provide any more clarity?
Well, one of the other points in the report, we deliberately made it very explicit that people who spoke to us about this deliberately didn't give us names and locations, because they felt that they would be at risk if they did. So they didn't give us the names and locations to hand on. You know, whenever there were any issues that we felt we had to check out with PSNI or the authorities, we did that. But we weren't given the locations. One of the things I have to say about that is that, you know, people... One of the things that the communities were saying, and it was reflected that in the report, that phrase, the dogs in the street know what's going on. And there is a feeling that people do know what's going on. I mean, all sorts of people have said they do know and that this is nothing new. So if they know, why are they not passing it on to the authorities? You know, if the police aren't getting it, do the police know? Some of the communities thought the police knew and weren't doing anything. The police adamantly deny that. Do other people know? Did the press know? I had a journalist saying he knew about all this pubs and clubs. If he knows about the pubs and clubs, has he passed on the details to PSNI? You know, if other people in the communities know, have they done it? If they haven't done it, why not? Yeah. And if they haven't done it from a position of power, how can you expect people in the communities to do it when they're the ones who are actually feel themselves at danger? So I think there is a real issue about this, and I am hoping that a lot of the recent stuff will empower people to come forward in a way that makes them feel they're going to get an appropriate response, because young people in these communities can't wait. And if people think that everybody knows what's going on and that nothing's happening, that's very disempowering and disrespectful, and it's not good for children or
No,
their
I
parents.
totally agree, but all suspicions that you had, that you were able to...
Yes, anything that we
on.
knew, but as I say, I thought it was important to say in the report that nobody gave us details of names and locations, and people were very adamant to say that to us too, because they felt if there was any suspicion that they had done, and that they were found to have spoken to the inquiry, they felt they would be in danger. So they didn't give us it. We didn't pass on names of any pubs and clubs because nobody gave it to us, and for very good reason.
Thank you. Thanks, Chair.
Thank you, Joanne. Rosie's next.
Thanks, Chair, and thanks very much for the presentation on the report. Just like Joanne, there are so many issues arising out of it that, and to be honest, I haven't had time to get reading the half of it. There's so much in it. So I'd probably be flagging up just broad points. And I suppose what comes across to me is the failings that have taken place in the system where previous reports have flagged up issues. And there are, you know, for instance, in relation to the missing children, children going missing, it strikes me that there has been a complacency or a couldn't care less attitude at times to this, and I don't understand why. If people are in care establishments or care environments and they go missing, why would someone not be alarmed? And so there's something has been going on there which actually I find very alarming. But given that, coming out of different reports, then there were commitments given to gather the information, and what it said was there was an inability of the authorities to give information. At beggars belief, I don't know what that means. So
Was this, sorry?
Yeah, page 13.
In the,
An inability.
is this in the summary or in the main report?
Page 13 of the report under vulnerability to DSC.
Just so that I can... All right.
It's the second last paragraph on that page.
Yeah. Yes, at that point the authorities said they couldn't give it, they couldn't break it down, give it, that it would be too expensive to gather the information. And I think one of the things is too that people hold the information in different ways, you know, in manual files, and they have to go through individual case files to get it. So at that point, the response was that they couldn't give the information without inordinate expense. Now, as a result of all that, and as you remember, Michelle McElveen asked a series of questions and then proposed a private members' bill, and then that proposal was withdrawn on the basis that there would be an administrative system for collection and an action plan, and that's what's appended to the report, is this action plan. But our conclusions from that was, well, yes, there was an action plan which has been partly implemented even now. It was never regarded as being an ongoing action plan, but it's still not finished. And although data was collected, and you would now be able to answer the question of how many young people were missing from care and break it down by trusts. That information has not been analysed strategically and directed towards this issue. So there's been a sort of partial implementation of that, but not going far enough. And this bit about the lack of analysis has been a theme throughout the whole thing. It was something we heard very strongly from the police, especially from frontline police officers, who gave us a very strong impression that they were picking things up and passing it on, but they didn't think there was anyone having an overview. Some of that has changed in the past year with Operation OWL, but I think that needs, and I think we've seen the benefits of that, but that actually needs to be done in a more committed and strategic way, that there has to be a commitment to analysing it. And as we said earlier, building upon the good work, Operation OWL has now stopped, but we're told that it's been subsumed into other parts of the Public Protection Unit's work. But many people that we spoke to were very keen to ensure that the benefits of that approach in Operation OWL were recognised and continued, because it was showing results in terms of building up a picture across Northern Ireland of what was happening.
But at the same time, there were people in positions of authority who felt unable or couldn't or didn't really want to go to the bother of trying to create a system that would bring out the information that would protect children from being exploited. And nobody seemed to think that someone should be held to account for that, and I find that inexcusable. How do you respond to that? You were uncovering that, obviously.
Well, what we've said in the report is that that it should have been, we're recommending that it should have been implemented, and we've pointed out that it wasn't, although the data was gathered, it was a sort of halfway measure. It was gathered but not analysed and not used. So I think we have said that. We haven't identified a person, and I don't think it would be our purpose to do that. If you want to, you know, in carrying this on, and I know you're meeting other agencies, asking them why they didn't do it, why they didn't think it was a priority, that's a clear role for this committee to do. But I think we've done that, and we've set this out, and we've put out the action plan, which we're told wasn't consulted on and wasn't disseminated, which is why we put it in the back of the report so people could see it. And we said it really has to be taken forward further.
Okay, and I understand that you were compiling the information, so you're not at fault there. But why should we, and society here in general, feel confident that something different will happen, that this will be treated differently? How can we feel confident?
Well, I think that's a question of monitoring this now, and that was what the Minister was saying yesterday, and he was setting out some sort of quite tight timescales, and there has to be a monitoring situation to make sure that it doesn't happen again, that issues are flagged up and are not followed through. So I think this is a question of what something's going to come out in January, I believe, and then something in March, and I'd imagine that this committee would have an interest in making sure that these issues were taken forward and implemented from now on, and we learned those lessons from the past.
Okay, can I just ask you something about, you spoke to something like 580 children? And
altogether, that's including the schools, yes, and we had a number of consultations with young people.
Were all those people who were affected by exploitation?
No, this was the prime aim. Well, a number of them would be that we wouldn't know about, you know, and they might not even recognise it themselves. I mean, quite honestly, sometimes when the young people were discussing it and the sort of light bulb was going, you know, in their head about what was happening, and they were absolutely adamant that other young people need to know about this, and they were going to go and tell their friends, you know. But that was exactly it, that we were not focusing just on people who were known to have been sexually exploited. We were actually trying to get out to other young people, and the whole process of doing this has also raised awareness. And with parents saying they were going to go and tell other parents, and young people saying they were going to go and tell other young people. So it was certainly a matter of great interest to them. But no, if we had only focused on children who were known to be sexually exploited, we wouldn't have got this picture of what's happening. And that was, I think, what we were asked to do, is how widespread is this, as far as we can know, and what is it that's happening? What is it children have to be aware of that they could get involved in, you know, without meaning to get drawn into What are the danger signs? What is it that parents have to know about that's happening out there so that they can advise and protect their children? And that's what the children wanted them to do. The prime message from children, parents have to know about this.
Can I ask?
Can I add a bit?
Yes.
I think it's important as well to recognise that in some of the interviews that we had with young people who had been exploited, it wasn't until they had had work done with them, quite often by somebody in the third sector, either Safe Choices or another organisation, that had worked with them to explain what was happening to them, did they then recognise that actually it was very exploitative and it was abusive, and it's quite a journey for them to reach those conclusions that this is not normal and this is not acceptable. And while they're doing that, they're so susceptible to other types of exploitation as well.
Can I just ask you about how significant social media is in the increase in exploitation of children?
I think it's really key as the social media has grown and very rapidly. Then a lot of parents know about putting parental controls on the internet on your PC at home, but they don't think about it with their own mobile phones and with tablets that they've got and various other things, and that there's a lot of education needs doing directly with young people and parents about setting controls, about talking about what can happen to just your photograph. The fact that there's now apps that can locate where your photograph was taken and that people can track you to that point is not known widely. So the whole social media thing is really difficult, but also the sexting, because the minute that has happened, then that photograph is out there to use to bribe children and coerce children into acts that they wouldn't normally take part in, because they fear what is going to happen to them if they do. So it's the education directly with the children and with the parents in order to help them to do that. It's really key.
How confident are you that some measures can address those very real concerns?
I'm quite confident, actually. If you look at CEOP, they've got the Think You Know programme, and that's all around internet access and reporting abuse and parental controls. What it is about, what the key is about, is professionals understanding it as well, so that they can deliver that as part of the role of working with children and families.
But it's also trying to make sure that young people get a proper response when they do admit that they've done something like that, because they can be overwhelmed with feelings of shame for having done it. And we have to make sure, and it can lead to self-harming and things because they're just so ashamed. And we have to make sure that, as consistent with the normal principle that you can't consent to your own abuse, and you've been manipulated in a sense into that, when young people do say that something like this has happened, that they get a supportive response, whether it's from parents or carers or teachers or whoever it is that they choose to tell about it.
Thank you.
Okay, thank you, Rosie. I have 4 more members have indicated. Gordon.
Thanks, Chair, and thanks very much for your work, indeed, bringing this report forward. We do appreciate it. In relation to missing persons and how missing persons are reported, how they're managed, mainly, I suppose, by the PSNI. In my experience, agencies and the public generally want to inform the PSNI when someone goes missing. But after that, I want to know how we're going to close the gaps, because the PSNI tell us have limited resources. They've probably limited skills in relating how to deal with these cases. And as a result, there are, I believe, major gaps. We're aware of it even locally in relating to people going missing. Once agencies inform the PSNI that they have that someone's missing, they tend to step back and leave it with the PSNI. So, do you see that as a risk that needs to be addressed?
I think it's really important that whoever is the call handling for the PSNI, so that first point of call when somebody from the public, a parent or some concerned public member, puts that call in, that it is met by somebody who can screen that call effectively and has a series of questions that would highlight not all the vulnerabilities that that young person may be facing, but also child sexual exploitation. And what we're seeing across a lot of police forces, that is, they're beginning to see that that needs to improve, but there's still some way to go. And then it has to be a quick and efficient referral pathway into the PPU if there are concerns around child sexual exploitation that are flagged up through that screening process.
Can I add that there is, guidance on this for police and social work? One of the problems has been that it was always meant to be backed up by joint training, and that has never happened. And again, that's very, that's something that would have helped, because we did find, the police are utterly frustrated about it. But the residential care workers told us, what their approach was and how they will try to dissuade young people and how they will follow them and take them off buses, take them off trains. Although sometimes that's not going to be possible. We did a snapshot survey of children's homes over 2 24-hour periods, one during the week and one at the weekends. And we found that, some children's homes only had 2 members of staff on. So if one of them goes out, there's only 1 member of staff left. Very worryingly, 2 children's homes only had 1 member of staff on duty. So there are things like that about the capacity to respond. And we also feel, when we went round the trusts, the trust management were adamant that their workers in residential care were well trained and well supported to deal with these issues, and that they had confidence with them. When we spoke to young people, etc., and some of the other people out in the community, there was feeling that some staff were not confident, and certainly the police thought they passed the risk over to them as soon as possible. And some of the young
inconsistencies across the
there are inconsistencies. But one of the things we said, which may sound strange in the report, we said, we think if management are so adamant that their trust, that their staff are well trained and supported, they should make a very explicit statement of support for their staff, so that if their staff have done their best and it hasn't worked out, it's a management accountability, because there is this issue. This is what one of the young people that had said made a very pertinent comment about this, and we said, well, what's the difference between a care worker and a parent? And that's it. And one of them said, well, your parents care about you, the staff only care about themselves. And I don't think they meant that in a dismissive way, in the sense that staff don't care. But there are more implications for staff if it goes wrong, and they are actually kind of protecting themselves in that, And that insight is one of these things where you say, actually, you're absolutely right in what you've said there. So if management are convinced that their staff are well trained and supported, they have to deal with that. And I was reflecting back on years ago when I was doing work with HIV/AIDS, when Edinburgh was a big capital of that for a while. And I know that the staff that were working in schools and that felt very supported by a statement from management that said, we realised that our staff were working in a very difficult environment and often on the verge of legality, and we support them. They had confidence in them. And staff at the front line, they need to be well trained, they need to be supported. They also need to feel that if something happens and they really have done their best in accordance with the guidelines and the training that they've had, that they're not the ones who are going to be held accountable for that.
Okay, just takes me on then to my second point, and Glenn, perhaps you have an input. We're talking about care homes, and the recommendation there, key recommendation 5, talks about the need to upgrade standards for inspection within care homes to ensure they promote a culture conducive to respect the best interests of the child. But surely us sitting here today would expect that those standards are already in place within care homes. And I think that, what assurance can you give us that RQAA will be proactive in monitoring, managing and auditing homes to ensure that standards are there?
I think it's a very important point, and just to say, first of all, there are standards for inspection of children's homes which exist currently, and I think the recommendation is aimed at looking at revising those standards. When they come to be revised, they are revised taking account of all of the issues that are set out in the report. And particularly, I think Mr Dunnett will be looking at how the staff do respond to situations where children go missing. Some of the children would have said that, going missing doesn't necessarily mean they're placing themselves in harm's way, but going missing is clearly also a signal that some young people may be extremely vulnerable to others who might be more predatory towards them. So we would undertake currently inspections on a regular basis of children's homes. Unlike our other inspections, because of the question of confidentiality, we don't publish those reports on our website, but we make them available to the organisation with responsibility for running the children's home, and we have a very thorough system of follow-up to make sure that recommendations that we set out in those reports are implemented.
Okay, and it's not just about looking at the standard of care and the cleanliness, it's about process, it's about procedures. Yeah. It's about
these standards will deal with things like the nature of the relationships between the staff and the young people. And I think within the report, one of the things that we've said is one of the biggest safeguards against children being exploited or vulnerable is having a trusting relationship with an adult. And I think it would be remiss of us not to say that when we met with and spoke to frontline care workers, they told us about the efforts they go to building trust and confidence in working with children and young people. And I think in the executive summary, my eyes caught a phrase on page 6. The staff said, "We care enough to say no." And sometimes it's the imposing of the boundaries that raises the challenges. And we heard some incredible stories of how staff try to manage risk where children they believe may be exploited through the use of mobile technology, where they go the extra mile, as Kathleen said, in trying to bring people back when they've gone absent if they know where they are. It's a very complicated and challenging business. And I think, certainly from our point of view, we want to make sure that not only the staff supported, but that they have the resource and the capacity to do what they need to do.
Okay, it does mention there about the department should issue a circular and associated guidance stating how these issues should be taken forward. I suppose to us we're fairly hardened to it, but that seems a rather light way of dealing with it. Issuing a circular, is that?
That was in the meantime.
Everyone,
yeah, it's in the meantime.
Circulars these days, and not many of us take notice because we're overloaded with them.
I think this was a kind of in the meantime thing. And just to say, one of the things we were getting at that is it's the culture in children's homes, because you can go to something and you can, inspect. I don't feel I don't know much of this, but all the kind of standards and all of that. But we'd heard about some ways of assessing the culture in children's homes and looking at other things, like looking not just at the fact that something was recorded, but how it was recorded. How did the staff refer to the young person in that? And there are some emerging ways of assessing the culture in places like children's homes that build on that kind of thing to try to get to the quality. How do they talk to the young people? Is this an environment that is, respectful and affectionate, not just in, as I say, a tick-the-box way, but actually trying to get a feeling for the fabric of what's going on? And that was really the thing that we were trying to get at. And we know that there are some discussions going on about that kind of approach. And given that, we've got some comments in the report about young people who weren't happy in their placements, who felt they were chaotic, and who actually, being with the abuser was, from their point of view, a better place to be. And we actually have to try and make it so that the children's home is an environment where they are truly valued and where they feel valued and where they feel safe. Yeah. So we're looking at other ways to do that, to enrich the current standards.
Okay, thanks very much. Thanks, Chair.
Michael, next.
Okay, thanks very much. And can I say that it's a very important piece of work, the report that you brought forward, and I think we're very grateful for it. I have just a couple of points to make, and it's in terms of the police appear to be saying that they're making progress in this issue, and they're talking about around 2,000 convictions, or 2,000 cases with a 10% conviction rate, but big problems with reporting, prosecution, leading to convictions. And again, it relates to the voice of the children and young people and the victims here. It's looking to a way to get youngsters to actually report the situation, to report what's happening to them. And clearly there's a major role here for education, major role for justice. This isn't just about the health service or social services. It's an indication of what direction of travel we need to be going in terms of the voice of young people, children and young people, to get them to report.
I think one of the key things here is their experience when they go to court and what can happen to young people and how they can be discredited and how they can be made to look really bad in the court process without recognising any of their vulnerabilities. And without doubt, that does spread from child to child. That experience will spread from child to child and will make it such that they will not want to report because they will not want to be in those situations themselves. So I think it's not just the education, it's the whole process that you have to look at, and making it easier for a young person to attend court and not to have to stand up in front of somebody that has raped you, that has abused you, that has subjected you to physical violence and a whole range of other things, but to allow processes that enable you to give that information into a court process without being exposed, given all the support to do that. And I don't just mean the hand-holding on the day, but I mean that luxury of time that you have to give a child to be able to take them through that process, but not the minute the court door has finished and found guilty or not guilty or whatever, but to continue that work to help to keep the child stable and able. That's the message that will go out to other young people. That will enable young people to come forward because they'll know they're being supported.
Yeah. Can I make a particular point in that? We've made some very particular recommendations about how court cases are handled, and we've recommended like case management, statutory case management and statutory time limits. Yep. And the case management thing is quite important, and I think again it's part of the, in a different way, the sort of legacy of Northern Ireland, where everyone is very concerned about independence and about making sure that all the legal personnel have their say, and I think judges are perhaps more reluctant to intervene in cases. Whereas I think we heard that in England, in the case management system, the judges are more likely to intervene to stop counsel from wearing down a witness. Yes. And I think that that's important, that we have to say, look, you know, this society is moving on, and we have to try and look again at some of these tensions within the system and say, how can we ameliorate this to make sure that it's suitable for the young person. One of the young people I spoke to, I asked him the question at one point, because this young person had started to report and then had withdrawn, and I said to him, what's a nightmare scenario? And the young person said, the nightmare scenario is at a court, even if you're on live TV, being questioned about intimate details of your private life and everyone watching you. You know, knowing, even though this person wouldn't be in the court, would be in the live television, and that sort of thing weighs heavily on a young person's mind. And I think there is an issue about making sure that the legal profession really understand not just child sexual exploitation, but child abuse. And also the juries, this is why, again, getting back to this issue about the public health campaign, that members of the public who are going to serve on juries, they're not going to get special training for that, you know, to go on a jury. But if there are general messages about what grooming means and the whole dynamics of it and what young people's concerns are, that would feed into the process as well. So we've made a number of recommendations round about that.
Because a 10% conviction rate appears to be very low.
Yeah, and people do say, what's the point? Because yes, it's very hard to report anyway, and to go through the process of making a statement, and then what will happen is, again, if people don't understand, you make an initial statement, and then maybe what you say later doesn't exactly tie up because you were being a bit hesitant the first time, and then you say, well, we can't prosecute that because the defence are going to make mincemeat of you here because you've got two conflicting statements. Understanding the processes that young people go through and trying to make sure that actually that can lead into a system of prosecution that is going to target the perpetrators and not let them.
I think it's also really important to understand some of the tactics used by those who abuse these young persons in terms of plying them with alcohol and drugs means that quite often their memory of it is not clear, and so that when they come to make a statement it will move around because they'll remember different bits. And unless we're clear about that, it doesn't mean that they're not telling the truth. It doesn't mean that what they're saying is not right. What it means is somebody else has used substances to disinhibit them, that make them then witnesses that are not quite so credible at the end.
Okay. In terms of, thanks for that, in terms of child abuse and children who are vulnerable to child abuse, as opposed to just specifically, in general, vulnerability appears to be in terms of the background, domestic violence, drugs and alcohol, mental ill health in the home. Would it be fair to say that children subject to sexual exploitation, sexual abuse, that those factors weigh as heavily as they do in general for child abuse, or are we looking at something different here?
I think it would be fair to say that there is an overrepresentation of children that have other vulnerabilities in their background, so either child abuse, drug and alcohol issues. Bereavement is a big one. Bereavement in early years of a child is a big one, and various, perhaps disabilities, mental health issues, or things within the family makes a child incredibly vulnerable to CSE. What we need to be very clear about is it's not exclusive. This could be my daughter, this could be your daughter. You don't have to have a vulnerability other than anything that is just being a teenager and not understanding that somebody else is manipulating you to a position that is beneficial for them.
I think that's a message we've got too from schools and from other agencies as well, that they're identifying more young people without those known vulnerabilities who are getting involved. I mean, things like the sexting, things like the party houses, which for some young people might escalate. I mean, they're bad enough as it is, but might also turn into other things. And I think that's a particular message that we have to get out. And again, without panic, without frightening people, saying there are things we can do about this. Knowledge is power, and young people aren't stupid. If they know what some of the dangers are, and if they're alert to the signs, then they can do some things to protect themselves as well.
And I think it's also valuable to say that quite often young people are identified as victims of child sexual exploitation if you are known to a service, and that it may be a professional who's had training that will pick up these indicators. If you're a family not known to services, then you may be really reluctant to have social workers come into your house or police come into your house. So there's a whole barrier of engagement there as well that makes it difficult for some of those families that don't have engagement with services in any other capacity to come forward.
Michael, I have 3 more speakers. Mickey first.
Yeah, thanks very much for the report and the presentation. I suppose it follows on from what Michael was saying really about the perpetrators, because it seems to be a huge disincentive, because there doesn't seem to be any great number of the perpetrators who are actually prosecuted, because it is a serious crime. And I know in your recommendation 9, I think you've talked about the Department of Justice having an interagency forum. And I was listening to an item on the radio on the way home yesterday, which struck me. They were talking about the report, about the police were saying how difficult it was to prosecute in these cases. And if you have organised gangs, which may happen to some degree, then they're not really going to necessarily worry about carrying on doing what they're doing, because they don't seem to be affected in that sense. So there has to be a double-edged sword in a sense, because you have to deal with the actual issue in the preventative aspect, but it has to be made extremely difficult for the perpetrators, and they should be aware that they will actually be prosecuted, and it is a serious offence, and they will do serious time in that sense. And that doesn't seem to be happening.
I'd like to say I think I think you bang on the button really there. There's a lot of focus on the victim. All of the focus is on the victim. And the offenders are some shadowy figure in the background that there's not enough attention paid to. If we don't remove those, then this is just a conveyor belt. Because if you protect one child, they'll just go and get another. It's a conveyor belt of children. So there has to be an equal, if not bigger, focus on those people who offend. And you have to develop the systems that allow you to investigate it in a whole range of ways. We don't explore the legislation around trafficking enough. There's quite a range of legislation that has not been used effectively over a number of years that we could use, and it's about getting better at using the legislation that's available to us. And I don't believe the legislation is not fit for purpose. I just think that actually we don't understand it enough to use it to the benefit of this area of work.
Well, I think there's kind of a myth that this is a subculture, but it's not really, because it's not that hidden anymore.
No, it's
not. I mean,
not.
and the report, I think, highlights very clearly that it's more than that. And that's why, and you're absolutely right, and rightly so, the emphasis should be and the focus should be on the victims. But the perpetrators seem to be almost doing it at will and getting away with it. And just a final point, at a recent meeting with Nexus, they were telling us, and they deal with cases of sexual abuse, etc., that under 16s there's virtually none at all counselling facilities available for those young people. And I'm sure there are many young people in the situation where they're being abused or exploited who don't have anywhere to turn to. And I think that's something that needs to be addressed as well.
That links to this, Mr McCarthy's question earlier about what we have to do with these young people when we know that they have suffered the abuse. We need to protect them, we need to prevent it happening, but actually if you've not prevented it happening, then that therapeutic response, and I'm not just talking about therapeutic support, which a lot of people do, I'm talking about some sort of recognised programme that will help somebody to get over this in the best way they can and make the most potential of their life from that point onwards.
Thank you.
You can say we also, mentioned in the report adults who've spoken to us who were exploited children, and they've made the point strongly that the lack of support for them has made it difficult for them to protect their own children. So, there's another angle to getting into that as well, that we have to make sure we give support to all of these people.
Thank you.
Thank you.
Paula?
Thank you. Thank you. I agree with what Michael had said. I'm welcoming this report. I believe any report that comes before us and gets into the public domain and gets debated in this committee, gets debated in our chamber, that highlights the issues around child exploitation is to be welcomed, because it starts off another debate outside of the chamber and outside of the assembly. It starts off a debate around our dinner tables at home, in schools, in care homes, wherever that might be. So all of that has to be welcomed. As part of my role up here, I chair 2 all-party groups. One is the all-party group on sexual health, and the other is the all-party group on women, peace and security. On our all-party group on sexual health, we've had several witness sessions. One of them was from Brook, the Brook Advisory Group, and they had completed a piece of research themselves by asking various questions to the young people that were coming through their doors. And the research and the findings they came out with that was that such a high level of those young people that were coming through their doors were subjected to sexual exploitation. And these children didn't know that. These children didn't realise that. And only last week I was at a Women in Politics event in Belfast with a group of very, well-educated young women who knew where they wanted to go in life and were quite politically motivated. And they were sort of the age group of maybe 14 to 19 from right across our communities. And I had brought up the issue to do with revenge porn.
Oh, yeah.
And they just said to me, yeah, that happens in our school. It wasn't, shock, horror, this happens, this is part of life. So I suppose what I wanted to talk or ask you about is with the moving on period, and I 100% agree. There needs to be some sort of public health.
Yeah.
We need to be doing something about this. Only a few weeks ago, we were speaking about elder abuse and the fact that we need to look at something to do with that also. But I want to look at even our relationship and sex education skills, which is a big, big issue. We do not have a robust statutory obligation to provide either sex and relationship education in our schools. And I know from speaking with people social workers in care homes and children in care, there's not a statutory obligation there either. So how do we expect our children, a lot of our children, yes, will have parents like many around this table and many people I know, where we can have discussions, we can talk about anything, we can, that doesn't happen in every home, and it doesn't certainly happen in every statutory care home either. So I just want your opinion on that. Yeah. And, do we need to take something forward on that? Because I genuinely believe that's where we need to start with this. We need to teach our children about relationships. Not even to do with, sexual health or anything. It's relationships. And we're quite happy with our daughters. We'll send them out the door on a Friday night and say, you be careful, you watch what you're doing, don't you let such and such happen, make sure you get a taxi home, all of these issues. Do we say to our sons, see, when you're out, if you see a girl who's in trouble, or you see a boy who's in trouble, you get them into a taxi, you get them home, you try and get, we've kind of double standards sometimes with these things.
I think you're absolutely right. This is about healthy relationships and what a healthy relationship looks like. I think it goes one step further, because actually places that do healthy relationship education often focus on the normal heterosexual relationship and actually would never touch and would never mention same-sex relationships, what a safe, healthy relationship looks like. And also, we very often don't deliver it in a way that somebody with a limited capacity to understand can get to understand it. It's delivered in a very singular fashion, and we have to explore all ways of teaching young people what is a normal, healthy sexual relationship, and the respect and what is consent, because actually the biggest thing is what is consent and what is coercion is really muddled up with an awful lot of our young people today. So I absolutely agree. It's fundamental. It should happen in every school, but it should also happen in every special educational provision for young people, because there are a number of young people that are particularly vulnerable who don't attend mainstream school. Perhaps it needs to happen in our private schools as well, in our academies and wherever else young people attend. So
I think we have, and following on from the points Joanne had made, we have this idea in our head that people who have either physical or learning disabilities do not have sexual emotion or sexual feeling, which is it's a total nonsense. Yeah. So there's a whole range of people out there that we need to capture, though I do believe that we need to start at a young level and teach about relationship advice. And I'm glad you brought the point up about same-sex education as well, because we are finding as well on statistics that we have a group of young people out there who are being exploited because they've nobody to talk to, nowhere to turn to, and they are finding that it's maybe somebody older is giving them that reassurance and giving that, helping them through their thoughts and feelings. We're failing in so many ways, our young people. So I'm encouraged by that, and I think that's something we as a committee need to take up again. We did do it maybe 2 years ago on committee. We looked at our relationship and sexual health within our schools. It's something I think we definitely need to start to get that in early.
But it needs to be mandatory.
Oh, it does. I agree, 100%. Yeah.
For the work that you're doing in the cross-party groups, I would commend to you one of the supplementary work streams for the inquiry, which was the evaluation undertaken by the Education and Training Inspectorate of the preventative education as part of the statutory curriculum. I read that report and I was fascinated by what it told us about parental knowledge, lack of knowledge about young people. Like yourself, listening to the radio, I heard two very articulate young ladies being interviewed recently about this subject and talking about how they kept themselves safe. And there are very good mechanisms and strategies for young people to keep themselves safe in the school environment. I think we need to make that more widely known.
I mean, and we also know, sorry, Chair, if you just indulge me a little bit longer, I'm part of I follow a Twitter feed called Everyday Sexism, which is, it's a really interesting Twitter feed to follow, where you'll have people, women generally, it's women from all ages, and a lot of it is young girls at school who will be saying things like, yeah, today again heard 10 jokes about rape and how funny this was from, so what are we teaching our young boys? What is we as responsible adults teaching our young boys about how to treat women and about relationships? Because those young boys are going to become the young men of the future. So I think that there's so much for education.
There is. I think there's one other important point there as well. We've talked about schools delivering that education, but actually we need to assist parents to be able to deliver that education as an everyday drip feed in the home environment, and that's not something we do. And parents are very uncomfortable about it, especially if they've been victims of sexual exploitation themselves. They don't understand what is normal. They don't know how to do it, and people are really afraid of actually talking about what is a healthy relationship. So there should be some assistance for parents as well to be able to do that in their own home as a drip feed every day. Because one lesson once a year is not enough. This has got to be something we talk about regularly with children, about what is acceptable. But the consent thing is really important. It has to include the consent.
I think that's something we can take forward to do with our relationship and sexual education. I know we will take it forward in my APG, but I know this committee is instrumental in actually taking that forward. The next point I wanted to make to you was about my other APG that I chair, which is the Women, Peace and Security. And we have had many witness sessions from women in Northern Ireland, albeit they've been in closed sessions, and it's following on a wee bit from what Fergal was saying earlier to do with our organisations in Northern Ireland. I'm talking about paramilitary organisations now, so I am, and about abuse which is taking place, but even more importantly, abuse is still taking place. And the women are coming forward and they're telling us this, and any woman in this room that works along with women's groups and community groups in Northern Ireland will know that. This is happening. So I know from some of the reports I have heard on our media and whatnot, this has not been specific, and I know you had said in answer to Fergal earlier, some things have not been put across.
That's right, and I mean we're very clear that that's something that's happening now, and it has to be addressed. And one of the problems is, I mean, somebody we met said there were 4 generations of this in her family, and that's how difficult it is to deal with it when it's part of the culture, and even some of the cultures about getting status. There's this whole mixture of emotions, and if you're living in a community like that, it's very hard for young people to know what is normal. Very concerning situation.
And it's quite complex. The whole mechanism of it all is really quite complex. That people have got to really understand all the different complexity of it to be able to work then with the community to move on.
And what was becoming even more startling to me in some of our witness sessions was that the exploitation of children and young women and young men has got worse since we have had a ceasefire, or since '98.
I think
it has got worse.
Yeah, I think it's really important what you've just said as well about our young men, because there is a significant underreporting about the recognition of young men. It's doubly hard for them to come forward if they have been made to have sex with other men, because they're often perceived as being exploring their sexuality, and that it may not be at all. It may be that they have just been raped by somebody, and they find it incredibly difficult to come forward and are far less likely to disclose their abuse or even to push it as far as going for prosecution. So underreporting from LGBT groups and from young men is significant. We have to look at that.
And that again is something through relationship and sexual advice in schools,
we've made a lot of
recommendations that this should not be taboo.
That's right.
This shouldn't be something that you should hide from. This is something that has happened to you that wasn't your fault, that someone else took control of your life. Report it. It shouldn't be a taboo subject. It should be something that we are talking about at our dinner tables at night with our children, with our brothers, with our sisters, whatever it might be. and try. So I want to thank you, because a lot of the information in your report you have given me food for thought for the two all-party groups that I chair, because it will help us as we further that along. And as I said before, anything that comes out, anything at all, any research, can only be a positive whenever this subject is being discussed, not only in this chamber, or not only in this assembly, but outside of this assembly as well. You know, so we have to welcome that. Thank you.
Pam?
Thank you, Chair, and thank you very much for your presentation today. I think probably for most of us, it probably wasn't the report that we were expecting, and maybe doesn't have the availability for political point scoring that we expected, and it really puts the whole issue of abuse, all types of abuse, actually in front of us, and shows it for what it is, which is a responsibility of each and every one of us. I mean, I am involved locally with Women's Aid and helping for a number of years, and I'm well aware of the kind of issues of abuse and the fact that most of this happens within our own homes. Same with elder abuse. It's people known to us, close to us, carers. There are so many different versions of it, so we shouldn't be surprised to realise that, you know, child sexual exploitation, you know, is actually something that we all need to deal with. So I think it's very good, and I think we've learned an awful lot today from your presentation and your time here with us, and thank you for the work that you've done over the past year. I think it's very welcome. Paul touched on it there as well, but you speak here in the report about being a particular dimension for Northern Ireland in regards to child sexual exploitation. And I'm trying not to say CSE, because it kind of sounds like, you know, an exam, or it sounds like something not so important as what it is. And you're saying here that, you know, you've heard about the threats posed by powerful individuals with links to paramilitary organisations. Communities are reluctant to report these for fear of reprisals, and because they do not have the confidence in the ability of the statutory authorities to respond appropriately and effectively. And the fact that some offenders in the past were dealt with illegally by paramilitary organisations, which meant that there was no record of their offending behaviour that would link them into the protections afforded by the Sex Offenders Register and provisions for sharing information about individuals posing a danger to children. And that paragraph looks like it could have just come directly from Maria Cahill, and it's been a very big subject, and it's been good as another route to raise awareness of the whole subject. And I think it's fantastic that Maria has come forward and highlighted the issue as she has. But, you know, I know we're not talking about facts, and we are talking about facts, but we're not talking about figures today. But to what extent is that an issue in Northern Ireland? You know, how big a problem?
We had heard that you know, that it wasn't just in the rural areas, that there were villages as well that were dominated by powerful individuals. But I don't think anybody would, until people actually start to talk about it, I don't think you will know the extent, because people will know what's happening in their own communities, but not necessarily what's happening in other communities. And some of the people that spoke to us who'd said, you know, very, very adamant that we had to speak about this. And their perception was that if it was brought out into the open, then other people would feel empowered to come and speak about it. And so I suppose that's what is happening, because it's not possible, we said that, you know, again, we can't say what the extent is. We've started a conversation on this. You know, members as well have to have conversations with their communities and try and find out what is it going to take to help make people feel confident to speak up about it. And we've made a recommendation at that too, about statutory and voluntary agencies working with communities. I mean, I know somebody talked about a meeting in one of their communities, but it was held in inappropriate premises that the community didn't feel confident in going to, you know. So there is this whole thing about trying to do this from a position where the communities feel comfortable about it and know what's going to happen. So, you know, I don't think we can't answer how prevalent it is. We just know that we've had strong representations about it as being almost a way of life, quite honestly. You know?
We did ask one of the organisations what percentage of their cases were represented by that model, and it was quite a small percentage. What they talked about was the sexting, and the peer-on-peer, and the internet, and the social media as a bigger factor.
And I think it suffices to say as well too that certainly in the Minister statement it talked about may be a factor in causing, and I know in your report page 47, 48 and 49 has all referred to it was not possible for the inquiry team to accurately identify the prevalence. No one who spoke to us identified, again I don't like that term, CSE, as a targeted activity. There is no evidence of organised paramilitary activity. Quote. So, you know, there's a number of references there that says that there isn't a direct connection. There is a sense that...
Oh, well, we certainly, I mean, from what people said to us, as we said in the report, we felt that was persuasive and powerful. We felt it was very credible, and it came from different sources as well. And also, one of the interesting things about this is the way people talked to us about it. You know, we had people who came to talk to us about it, but when we held meetings, gatherings with statutory agencies and voluntary agencies, sometimes someone would mention it or put something up on the board, and some, you know, it would be discussed. It was discussed in some of our meetings, but it was one of these things where people would come up to you afterwards and say, "You've got to talk about this." So, you know, so there were discussions about it in our meetings with the Trust, but often people will come up to you on a one-to-one and express their deep concern about it. So from that point of view, that was quite a universal experience we were having about that. You know, they would come to different one of us after events.
We were left with no doubt that that what they were telling us was a true representation of what was happening to them in their communities.
And they told us, people will say to you, "Where's your evidence?" That's what they always say. But the evidence in the way that people want it is not going to come out until people feel comfortable about talking about it, and at the moment that's still a very difficult thing for them to do.
As it is with all forms of abuse.
Yes, it is, that's right. But particularly here, because they fear reprisals. As I said, people actually did say to us, "We would be shot."
Yes.
You know, people actually put it as brutally as that to us, and that's why we've been so careful about not identifying, you know, who's spoken to us, and being very clear that they didn't give names or locations.
That's horrific. Could I just say, as a last comment, Chair, because I know we're well behind, the education part of your recommendations, I think, of vital importance. And, you know, as a mother of my youngest, is actually an adult now, 18, and I think there's a huge fear out there among parents, because, you know, parents now are maybe only just trying to get grips with technology and how far we've come with the different. You talked about, you know, safeguarding and computers and devices, and that's a whole new world. And it's something it's scary, and something that, you know, when we don't know about something, we tend to avoid it or leave it to somebody else to look after. But I think it's about the education is so important, and as you say, not just of children, but of the population and parents in particular, because, you know, they're the ones who are going to have to deal bringing children up from now on in, and it's only getting worse. It's a different world from now than what I experienced in my childhood, with little access to anything. And it's something that we as adults now are not well experienced in. So we need help, we need educated, so that we can help children of today to get through what are going to be very difficult years.
Can I refer to one recommendation that hasn't been referred to in any of the discussions we've had, which is the one about involving young people in a review of youth services? Because we received a lot of, you know, comment about that, about what else is there for young people to do that is more attractive. They go to the party houses because it's fun. And one young person, I was at a meeting, actually said very explicitly that, you know, once you're 16, you get fake ID and go to clubs. Before that, you go to parties. And it's that kind of 13, 14, 15-year-old group that seem to be very vulnerable. And I'm aware that some people will regard things like youth services almost as being a kind of frivolous thing at the end, icing in the cake, but it's absolutely critical. And it's not necessarily a huge investment. People have said that there is a big investment in youth services, but it's in a sort of 1970s model, and buildings that are underused, and some youth workers have said that themselves. So we have to find out from young people what kind of services, using public funds more wisely, would they use. Not only would it be a good activity, an alternative activity, but it would allow them access to youth workers, who some young people have said maybe the youth workers could mediate with PSNI with us. You know, it's another route for relationships. And I'm only saying that, sorry, Chair, just because nobody has mentioned this, and I wouldn't like it to think that this was something that was just kind of icing in the cake. I think it's actually pretty central to addressing this issue.
It goes one step further, actually, in so much as if you have a child that has been sexually exploited, there is a stimulus around that child, a very negative one, the excitement of party houses and drug and drink and alcohol, but you remove the child from that position and put them somewhere else, they're in a vacuum then. And you have to surround them with positive activities, positive experiences. You have to invest in that. Otherwise, they're going to drift back they're going to be easily pulled back into that world again, because there's nothing much there supporting that that exit from lifestyle.
Okay, thank you, Pam, for that. Rosie, was it on this, or did you?
Yeah, I mean, I just did want to make a comment because the Maria Cahill case was raised, and it's been, you know, in the media for a long time, and some very salient facts and factors get lost in it. And the most unfortunate thing is that those allegations were made against the person who, because they weren't proceeded with, has now led to a possible abuser being now free before the law because he's been declared innocent. So that, I mean, that was unfortunate, and we don't know if that was ever going to be proven right or wrong. That's unfortunate. But the relevant factor is that the alleged abuse in that case took place in a family setting, and the remit of this report largely deals with children in care, children in unsafe situations beyond the home. So, I mean, there is a difference, that it's very difficult to bring in procedures to cover the family setting. I don't know how you do that. You can bring in measures for public bodies, for statutory agencies, and you can give advice and all, but when it's happening in the family setting, it's more difficult and it's different.
I think we know, we're very clear that child sexual exploitation is a form of child abuse, you know, and that some of the learning from this will actually feed into the child abuse generally. Like, we're very, you know, we talked about the out of hours issue and the need to join up the services, but we're saying that's not just actually for CSE. That should be, because people might not even identify, you know, and it would be not perhaps a very good use of public resources to have one little PSE resource like that. It would be for people who have got concerns and don't know what to do with it. So, you know, there are going to be crossovers in this. Yeah.
Okay. Oh, sorry, George. Yes, you had indicated. Sorry.
I'll be very brief, and I know the day's getting on. And I'd like to thank Kathleen and her team as well for the excellent presentation that you have given us, and the report as well. My question would be, apart from the Maria Cahill case, is there any record of how many perpetrators has been apprehended for this horrific crime, and what was the jail term that was handed down? And in my opinion, my personal opinion is that they certainly anybody that is apprehended for this very, very horrific crime should get the full rigours of the law imposed upon them.
Yeah, I think we're back to the reporting issue. Until we start collecting data efficiently against what we know to be happening, then we don't have numbers. And we don't have directly numbers from this, but we are back to, it's only over the last couple of years have people understood how important it was to have collected the data, and that it's been sidelined, you know, everywhere.
So also there's the fact that CSE isn't a specific crime. And, you know, we've heard of the whole spectrum of activities that can be part of CSE. So people they'll not have a conviction for CSE, they'll have a conviction for something else. And I think one of the things we're trying to say in the data collection, there should be a system like for flagging these things up, so that it's a CSE-related crime, even if it's prosecuted under something else, and that has to be part of the data collection. So that does make it difficult to say how many people have been prosecuted for CSE. We've only really got things like the underlying things and trafficking, and sometimes also when they have a number of charges, they'll prosecute on the basis of the most important one, and then the ones underneath don't actually get flagged up. Maybe that's grooming, So there is a whole issue about that, about harbouring, how the system can actually make sure that the information comes through and is flagged up, even if it isn't a specific crime.
It's very much the Al Capone method. If you can't get them you get them for tax evasion, if you can't get them for anything else.
In my honest opinion, they should be made an example of whoever is caught.
Yeah, they should. And I think there's a bit about making Northern Ireland a hostile environment for people who will exploit children is a very strong point, making it clear that this is being taken very seriously here, and people are going to address
Made an example of.
Yeah.
Yes.
Yeah.
Okay, George. Well, look, folks, thank you. I mean, it has been a useful discussion, and you have been very generous and I think honest with your findings and with the time. I mean, it remains of concern to me that, which is outside your remit somewhat, Professor Marshall, but it remains of concern to me that these issues have been flagged up for a considerable period of time in advance of the report by your own admission here today, which could ultimately and may have impacted in putting more children at risk or increasing children to exploitation or abuse. So I thank you for your time today. Thank you.
Thank you very much, Chair and members. Thank you.
Okay, members, moving on to the next item is the next session with the Minister and the Department. It's on page 205 of your tabled meeting folder, which is a copy of the Minister's statement on the inquiry report which was made to the Assembly yesterday. So we'll just give it a minute for our guest to arrive. Members, I'm going to say at this point as well, just given time, and I know this is a critically important subject, and we do want to give it as much scrutiny and focus as possible, but just try, and all of us collectively, to keep our questions brief, and I will make the point as well to the Minister and the Department.
Report anyway, Commissioner, and it took how long to get Commission in 2009. It's certainly about after I left. The department got up with them. You're all now, right? Jim's going to take you.
No thanks for this.
Okay, Minister, you're very welcome, and we have Sean Holland. Sean, you're welcome. Chief Social Services Officer at the Department, Fionnuala McAndrew. Again, Fionnuala, very welcome. Director of Social Care and Children at the Health and Social Care Board, and Hugh Connor, Chair of the Safeguarding Board. Members, I do apologise, and Minister, for the delay. Obviously an important subject, but because of time constraints, I'm going to have asked members as well to keep our questions and comments as succinct as possible. So, Minister, I'm going to hand to yourself for some opening comments.
Well, Madam Chair, first of all, I don't mind being delayed at all. There's one or two issues out there in the country that have exercised my mind this morning, and I certainly valued the extra time. First of all, could I thank the committee for giving me the opportunity to attend this session so I can provide an update on the report on the Independent Child Sex Exploitation Inquiry, which was made public yesterday. And for ease of reference, I'm going to use the phrase CSE throughout this particular presentation as shorthand for child sexual exploitation. I know that Catherine Marshall, the chair of the inquiry team, along with Stella Taylor and Glenn Houston, have already briefed the committee for what turned out to be quite a long time about the report. Members will be aware that I made an oral statement in the Assembly yesterday on behalf of myself and Ministers Ford and O'Dowd I paid tribute to Kathleen Marshall and those who assisted her for the work, and I would like to repeat that here today. I'm glad actually I got a chance to thank her personally there in the Rotunda. In addition to those made by other departments or agencies, there are recommendations made within the report for my department, the Health and Social Care Board, the Health and Social Care Trusts, and the SBNI. For this reason, I have, along with Fionnuala McAndrew, Director of Social Care and Children in the board, and Fionnuala is very well known to you all, to Hugh Connor, who is the Chair of the SBNI, who is joining us today. Members will be aware that Mr McConnor has tendered his resignation from the end of this month. Consequently, it's likely that this is Hugh's last appearance before the committee as Chair of SBNI, and I'm certain that members will want to wish him well as he moves to what is truly retirement. And of course, Sean Holland, the Chief Social Services Officer, has been with you many times before. Those of you who were in the Assembly yesterday, and I think that was almost everybody, will have heard my statement and the media coverage on the report. At this stage, I hope that all members will have had an opportunity to consider that statement in full. Some of you may also have had an opportunity to consider the report in full, though I accept that that was quite a bit of reading. It's quite a comprehensive document. So I don't intend to repeat everything that was said yesterday. But I think members, just to refresh members' minds and make them aware of the key findings of the report, which I'll summarise briefly as follows. First of all, the report quite clearly indicates that child sexual exploitation exists in Northern Ireland and takes a number of forms, ranging from planned or systemic abuse to relationships between under 16s and those a few years older than them. CSE does not exist here in the same way as found in places like Rotherham and Rochdale. Very importantly, there are no cover-ups, there's no corruption, there's no lack of commitment on behalf of the agencies or individuals, and there's no ethnic minority dimension. That does make it radically different from the situation, particularly in Rotherham. Some children and young people are more vulnerable than others, including disabled children and looked after children. And the internet and social media are particular challenges and can facilitate CSE. Drugs and alcohol also play their part. There are elements of organisation to CSE here, though it is not thought to constitute organised crime as defined by the National Crime Agency. We need to work to address underlying vulnerabilities in children and young people and the range of issues that render them more open to sexual exploitation. CSE is not a looked-after child-only problem. It's a part of life for other children who are not known to the social services and who have not been identified as vulnerable. The report has identified a number of children and young people, up to 120, who are considered to be at risk of exploitation. However, the number who may be experiencing CSE may be significantly higher. Such is the nature of CSE and child abuse more generally. The majority of it is hidden and unreported. We aren't going to solve the problem of children going missing from care by simply locking them up. We need to create safe spaces for them. We have a particular Northern Ireland dimension to CSE, that its links with paramilitaries. Some individuals are using their paramilitary links and fear of it that this engenders to sexually exploit children and young people. And finally, we have a job of work to do to further improve our understanding of CSE in Northern Ireland. We can never be complacent, and the solution requires a cross-departmental, cross-agency and societal response. And I appreciate Mr McGimpsey raising that issue on the floor of the House yesterday. There are a number of points I want to make in response of what was said yesterday in the Assembly by those who contributed to the debate, and I hope that this proves that we not only make statements in the Assembly, we listen to what members say and we take action on them. And hopefully that members will be reassured when they hear our views, even after only 24 hours. There have been repeated calls from some quarters, but not all, for a statutory inquiry to consider CSE in Northern Ireland. I remain wholly unconvinced of the need for a statutory inquiry and stand by the decision of the former Minister to undertake this inquiry in the way it has been done. Significant as this issue is, he did not want it to be a huge drain on the public purse, already under significant pressure, nor did I. I think that most right-minded people would agree with this. We have plenty of public inquiries that have taken many years to complete and consumed significant public finances. And the O'Hara inquiry is a classic example of that. This has been going nearly 9 years and has still to report. Now, that is not doing anything for those who were afflicted by this terrible condition. Equally, it's my opinion that the Pseudomonas model, which the previous minister instigated, was exactly commensurate with the problem that we were in, reported very quickly, recommended a series of actions which were promptly taken and eliminated the problem. And that was quick, sharp, fleet of foot. That's why I support the way in which the Marshall report was constituted. You have to ask yourself what compelling witnesses would have achieved. I believe it would have done little to add to our knowledge of the prevalence of sexual abuse, as we have seen from the Marshall report that young people who may be considered at risk will not engage if they don't want to. Statutory agencies cooperated fully with the Marshall inquiry and candidly offered their views. There is no suggestion in the report to the contrary. We also need to consider the faithfulness of some of those who did come forward to the inquiry to give account of the links between CSE and paramilitaries. A power to compel would certainly have put many of them off making a contribution at all. The statutory inquiry point is tied up with calls to hold to account. I will repeat what I said already and what I said yesterday. The inquiry team discovered no cover-ups, no collusion, no corruption, no lack of commitment on the part of the agencies and individuals, both at the front line and in managerial positions. Of course, this doesn't mean that we shouldn't be doing better. Of course we should. And we should have do more things differently. But across the full spectrum of the HSE services, we need to be continuously seeking to improve the ways they do things. The report highlights where things were working well and where things need to be and can be improved. We can always do better. This is not to say that no action has been taken over the past number of years relevant to a number of issues raised in this report and other reports. Indeed, there has been a significant activity undertaken in connection with child protection generally, child sexual exploitation, missing from care, and those missing from care over a considerable period. We have made service changes underpinned by significant additional investment, introduced new guidance, standards and strategies, and introduced new reporting mechanisms. If members want to, we will be happy to provide more details of what has been done either today or at a later session. I'm going to say, of course, the very fact we're few here, in the intervening period, we have constituted the SBNI, appointed the chair, and it's up and running, would indicate that there has been a general commitment to this issue. The Marshall report concludes that CSE is not a standalone issue, and the underlying vulnerabilities such as neglect, poverty, substance abuse and domestic violence can increase the vulnerability of young people to the risks which need to be addressed. A holistic approach to keeping all children safe from all forms of abuse and integrating messages about CSE into what already exists makes sense, and is an approach we have to consistently take, and this reflects the Department's commitment to strengthening and improving child protection and looked after services for all children and young people who need them. That is not to say that we don't need to take some specific responses to CSE and to missing children from care. Much has been said about the hidden nature of CSE and how little is known about victims and perpetrators. I would compare CSE with cancer. It can go unseen for a long time. It takes different forms. It took many years to improve our diagnosis and treatment of cancer, and this was an incremental journey. Today, recovery rates for cancer have improved greatly. But just because we haven't found a cure doesn't mean we are failing. If we can imagine that we can eradicate CSE, we're being unrealistic. But as with cancer, we must strive to deal with CSE in a more effective way, getting better at identifying it, preventing and disrupting it. Not long ago, people did not openly speak about cancer. This has thankfully changed as recovery rates have improved and people have been given hope. We need to give people, young people in particular, who are being exploited, the confidence to speak openly about, and the hope and belief that those who are harming them can and will be stopped. In our consideration of the recommendations or responses to them, this should be at the forefront of our minds. Now, I could turn to the recommendations of the report. And if there has been some overlap with what Mrs Marshall has said, I apologise. I wasn't here to hear the contribution that her team made. But as members would be aware, there are 7 key recommendations from my department and 13 supporting recommendations. Some recommendations require me to work with the Department of Education and Justice, some with the Health and Social Care Board. I have said there are a number of recommendations, both key and supporting, for the Health Board, the Trusts and the SBNI. I'm not going to say anything about recommendations exclusively for the other departments. That is a matter for those ministers, Mr O'Dowd and Mr Ford, and I am certain that their respective committees will be seeking an update from them in due course. Though I would say that we've had good support from both ministers on this particular issue. I can't complain about their lack of commitment on this matter either. Those key recommendations for my report, for my department, relate to a public health campaign on CSE-related issues, along with the DOJ guidance for parents and carers, including foster carers and residential care workers, and how to capture evidence when a child who has gone missing returns or otherwise is considered at risk of CSE. An exploration of the benefits of amending or adding to standards for children's homes to ensure that they promote a culture which respects the best interests of the child and takes account of the specific needs of separated and trafficked children and those affected by CSE. Along with the board and the trusts, we give consideration of how safe places can be developed for children and young people at risk, subject to or recovering from CSE, taking account of the models of best practice and the right and the views of young people and the international human rights standards. We will be ensuring that the planned review of the SBNI considers streamlining joint working arrangements to make them more realistic, effective and efficient. We also want to ensure that there is a clear reporting pathway 24/7 for reporting concerns about children and young people, including CSE, with appropriate feedback provided to those making the report, and along with Department of Education and DOJ, leading on the development of a regional strategy to prevent, identify and disrupt CSE. I want a coordinated HSE response to the Marshall report. As a result, I have asked a HSC CSE response team. Sorry for all the jargon here. I want that to be established, that response team, and I wanted to consider the report's recommendations for the HSC to report back to me by the end of January 2015. That's only 2.5 months away, so I think you understand how seriously we're taking this issue. That report will advise me on which recommendations should be accepted. If it is proposed not to accept any recommendation, I want to know why. The response team will then develop a detailed implementation plan which will identify who will do what and when, and thereafter I will receive a 6-monthly report on progress. I will ensure that the views of children and young people, parents and those with experience and expertise in CSE are built into the implementation process. I will ask the response team to set out how that will be done. I made the point yesterday that some of the recommendations for my department are already being progressed, including the development of the new safeguarding policies for both adults and children and new guidance and information sharing for child protection purposes. Also, I have already made CSE a commissioning training priority for the Health and Social Care Board and a CSE training strategy for all relevant HSC staff. And that has been drafted and once agreed will be rolled out across all the trusts with immediate effect. Given the significant risks presented by technology, and this is a theme we'll be coming back to many times, this is a very important issue. Technology is increasing children's vulnerability to being exploited. I am seeking the response of my ministerial colleagues to develop an e-safety strategy. This is being done through the executive process. I believe this is something that all departments are going to have to buy into, not just health. The point was made yesterday in the Assembly, and Kathleen Marshall has also made this point, that preventing and tackling CSE will require a collaborative and coordinated response, and I couldn't agree more. It is not just a health and social care issue, it is an issue for other sectors. I will need the support of other ministers, other departments, statutory agencies, voluntary and community organisations, community service providers, parents and communities if we're going to succeed in this task. This is a societal issue. I cannot, my department alone, deal with it in isolation. It was suggested yesterday that perhaps we need a ministerial task force to deal with the issue of CSA, and indeed that issue was raised by Mr McGimpsey. It's unfortunate actually he's had to go, because I said in the Assembly yesterday I saw a great deal of merit in that suggestion, and I am attracted by it and think it merits very careful consideration that we have a task force covering all of those involved, not just my own department. As you know, I have set up groups to look at the implementation of DHS SPS, but I think it goes much wider than that. Overall, I think Catherine Marshall's report was balanced in its findings. We know more about the nature of CSE in Northern Ireland and have a much better sense of the challenges and how we need to adapt and improve our services to respond more effectively. We do not have a precise assessment of prevalence, but that is the nature of child abuse. In that respect, we are no different from other parts of the United Kingdom, and I doubt if we will ever have a definitive data set regarding its full extent. But I believe we can continue to develop our understanding so that it is more readily recognised and reported, and that is extremely important. I am proud that it is a matter of record that in the Marshall report she states that there are many dedicated and committed frontline staff, social workers, care staff, police officers, health workers, youth and community workers, those in the voluntary sector, who are all doing their utmost for children and young people who go missing or who are at risk of CSE. And I am confident we have the human resources available to respond to the challenges and threats of CSE in all its forms and in all the threats that it poses to our children and young people. Again, can I thank you for the opportunity to meet with the committee and set out what I plan to do in response to the Marshall inquiry, and we are now more than happy to answer any questions. I have the experts with me, so if I am unable to answer any specific point, I will simply refer it to someone who does know the full answer.
Okay, thank you, Minister. Thank you for that overview. Just previously in the last session, in my view, we heard some quite alarming commentary from Professor Marshall and the team that were accompanying her, and that effectively was that the whole issue of child abuse should have been given priority since 2006 and wasn't given priority at that time, and by her own admission indicated that lack of action could have resulted in children being put at risk or abused. How does the Minister respond?
I mean, I am disappointed that Professor Marshall has formed that perception. I have asked for a whole list of the actions that have been taken since March 2007, and I will actually leave them with the committee, but I'll just quote a few examples. For instance, the department funded the Bernardo Special Service for Missing Children. That's the Safe Choices programme to the tune of £222,000. In 2009, we invested £1 million for Trust to train residential staff in therapeutic services. In February 2009, the department invested an additional £3.5 million in child protection services. And indeed, it's worth saying that there has been a 52% increase in investment in family and child care services since 2001. You are aware of the formation and the legislation that was brought forward for the Safeguarding Board for Northern Ireland. We have had joint social services, police guidance on missing children. I could go on and on and on, but there's an awful lot has been done.
With respect, I think people around this table know that there is a lot of ongoing good work in this regard. But I'm asking specifically, in the previous session, Professor Marshall alluded to the fact that this issue should have been given a priority since 2006, and by dint of it not being given a priority, it run the risk of children being at risk or abused.
But the report's very clear that there was no sense of a cover-up, there was no sense of maladministration, that the officials were taking it seriously and took a whole series of steps which directly or indirectly helped the situation. But it also said there was more that could have been done, and I accept that.
But the report didn't set out to explore if there was a cover-up or collusion. It set out to look at the extent and nature of child sexual exploitation and actually examine how effective safeguarding processes were.
Yeah.
And what I'm saying again is that in the previous session, Professor Marshall did indicate, and I think that that's a note of concern for all of us, that this issue was not given priority and should have been as far back as 2006, and therefore ultimately put children at risk.
What I can say to you is that I respect Mrs Marshall's comments. What I'm saying is that if full account is taken of the large number of steps that were instigated between 2006 and 2014 this issue, they will see a very clear pattern of taking it extremely seriously. Now, do I accept from her report that much was done but a lot more is required? I do accept that. But that's the reason why we instigated this report. That's why we funded Bernardo's to carry out their detailed analysis of it, because it was very useful to have an outside advisor telling us what could be done. But what I can also say, that she concludes that we're nothing like the situation which was, for instance, occurred in Rotherham, where there were 1,400 children who were sexually abused, and very clear evidence of gangs from ethnic communities carrying out that terrible abuse, and officials turning a blind eye and ignoring reports and material. Every time new information became available, it's quite clear that my officials took action.
So, in short, do you believe that the Department of Health have done everything within their gift and the Department's gift in relation to ensuring that this issue was given priority and actioned on the basis of reports that actually date back to 2001?
Well, first of all, I would accept that the Department took a lot of action, but Kathleen Marshall's report indicates that more could have been done. I think it would be very difficult to indicate that did that lead directly to children being made more vulnerable. But with the hindsight of the report that we now have, and the thematic review, which, as you know, will be bringing out its report, I am sure we could have done things better. But we're in a very different place to the rest of the United Kingdom in that respect, where heads have rolled left, right and centre. People have been forced to resign because they overlooked damning reports and didn't take them seriously. It's quite clear with the knowledge our staff had, they were taking very strong action to try and protect children. But as it turns out, we need to have taken more.
Okay. If more could have been done, whose responsibility is it?
Well, ultimately, the responsibility would have been the various ministers in charge at the time. There was from 3 different parties. But, of course, they wouldn't have had the knowledge that they now have of the situation. And also, to say, the development of internet technology has moved so quickly that things even in 2006, which were unimaginable, are very common now. The vast majority of our children now have access to the internet and mobile devices and are being exposed to material of a sexual nature that could never have happened even a decade ago. So this is a very much a situation that is moving very quickly. I'll ask Sean to come in on this, but I feel, compared to our other authorities throughout England, our situation is nothing as difficult and testing. But yes, we need to do more, and this report's telling us to do more, and I hope I'm showing by the immediacy of the action that's been taken that we're taking it very seriously.
Did we need to do more in 2006 or further?
Sean, what do you feel?
Chair, obviously you don't want me to read out a long list of actions we've taken, but I would highlight a few that I think are very germane to the point that you're pursuing. If we go back to 2006, a date that's been mentioned, I think that refers particularly to a Social Services Inspectorate overview report. Can I point out that that was work that was actually done by the Social Services Inspectorate, which was part of the department. So that in itself was the department doing something about the issue. They were inspecting services. When they looked at services, particularly those relevant to looked after care, they identified that there were risks to young people in residential care. Now, a recommendation was made in that overview report, which was particularly about doing interviews with young people when they'd run away from care. All the trusts established action plans in response to the recommendations and implemented actions. So they had a specific recommendation that was relevant to child sexual exploitation, and they implemented the action that was recommended. I highlight that action because it's illustrative of the issue about trying to believe that at a point in time, if you did something, you would cure this problem. Because the very action that they took in response to a recommendation Professor Marshall's report of 2014 contains really revealing interviews with young people, highlighting that actually doing that probably doesn't make that much difference. So I mentioned that because you can implement recommendations in good faith, people can take plenty of actions, and hopefully it moves the situation on, but you're always just operating with the knowledge you have at the time. So in 2006, with the knowledge that was presented as a result of an inspection report, people took action. That action continued throughout the years between 2006 and 2014. There were a number of actions that were particularly relevant to child sexual exploitation. Indeed, I could take you back to 1995, when we introduced a definition of child sexual abuse that included child sexual exploitation.
And again, I did indicate that there is ongoing work, and I accept that from a number of agencies. But I know he specifically referred the Social Services Inspectorate report. But in the inquiry report now itself, on page 24, it refers to the work produced by Include Youth, Out of the Shadows, in 2001, which made a number of recommendations, many of which are still pertinent. So it's not that the situation, those recommendations are still valid, but haven't been actioned.
No, I don't think that's correct. I think if you were to, if you wish, we can do a mapping exercise to map the actions that we've taken that are relevant to the report in 2001, the inspection in 2006, or any of the times this issue has been raised.
Let me give you another example, just let me give you another example. The Minister indicated just a few minutes ago about bringing forward the response to this inquiry by, I think it was January, Minister, you said, yes. January 2015, which would consider the recommendations from this report, and then you talked about a detailed implementation plan.
Yes.
Now, a detailed implementation plan was recommendation 3 in the Bernardo's report in 2011. You know, and I quote from it, and it was the board that was tasked at that time. The board should progress the development of a targeted and fully resourced action plan on sexual exploitation that includes, but is not limited to, consideration of the following issues. And it details all of those issues in terms of data collection, competency, best practice models, etc. That was recommendation 3 in 2011.
And
we now have a recommendation for an implementation
between 2011 and now, a number of actions have been taken that are relevant to that recommendation. I mean, Fionnuala can comment in a moment about the actions that the board specifically took.
But, Sean, with respect, that one wasn't. If we're now being told that we have this inquiry, that we have a report coming to the Minister's desk in a few months' time that may consider the recommendations from the inquiry, one of which will be a detailed implementation plan.
I think an implementation plan in itself probably isn't that significant. It's the actions that you implement in an implementation plan, and there were a number of actions that were implemented by the board in response to the issue of child sexual exploitation dating from 2011, but also before that. But as I said, I'll pass over to Fionnuala, who can talk in more detail about the actions the board took.
Thank you, Sean. Chair, just to reiterate, you're going back to 2006, and I would just, before I talk about the 2011 work, just like to point out that I think significant measures stemming from the 2006 report mean that the service is more readily available, easily accessible, and there's a heightened awareness of child sexual abuse within the service. So in relation to that, I would just point to, very briefly, the Unicini single assessment tool that is a standardised process for assessing the needs of children for all referred to social services and incorporates child sexual abuse. And I would also point to the formation of the gateway teams, or a single point of contact for anybody who is concerned about a child, with our most skilled and experienced social workers at the front door, taking those referrals and assessing them. And I think those are measures that are significant and have strengthened social services response to children. Specifically, the board was targeted with improving data collection and monitoring particularly in relation to missing children. And I know you probably want me to talk about that, and if that's appropriate at this juncture, I'm happy to do that.
I think we can come back to the subject of missing children and how that's reported. And I think members
so
will...
not in detail, but measures have been taken forward in relation to the data collection on missing children and also children who are potentially at risk of child sexual exploitation. There's been a lot of work on policies and procedures, staff training, and looking at the best methods of responding to children who are at risk of sexual abuse and child sexual exploitation. So whilst the board might be criticised for not having provided a detailed action plan, I would suggest to you that a lot of the measures that I can point to, and as Sean says, we can map those out, were a direct response to the 2006 Child Protection Report. They were a direct response to the Include Youth Report and to the Binoculars Report. Can more be done? I don't think any director or any manager of social services would sit before you and say, no, we have refined our processes and our systems as much as we possibly can. Of course, more can be done, and I do believe that Professor Marshall's report gives us a lot of indication of where we should put our energies as we take the recommendations forward.
Okay, well, just two references in the report, one of which is on page 13, and it's specifically talking about the 2006 report. But it quotes, the inquiry has ascertained that some of the actions in the plan have been completed, but others remain outstanding. And on a similar vein, and I do want to raise this point because I think it's critically important, again, the report makes reference to the private members' bill that was being brought forward 2009-10 by Michelle McElveen around the missing children and runaway children, and the need to legislate and provide accurate numbers around that. And the report refers to that she experienced a great deal of hostility from the department and from some children's agencies for having raised the issue.
Yes.
The bill was ultimately withdrawn, and there was an agreement that there would be an administrative system for the collection, collation and recording of quarterly statistics and the formulation of an action plan.
Yes, and Madam Chair, could I say that if Ms McElveen felt that she'd been treated badly by officials, on behalf of the Department, I'd wish to apologise unreservedly. It was certainly not the intention of the Department to make her feel this way, and I'm sorry she was left in that position. I was very aware of this at the time because I was chair of the committee, and I was aware that of the intention of bringing forward this private members' bill. And an agreement was reached between Michelle McElveen to deliver the policy intention behind her private members' bill by administrative means. And given her interest in missing children particularly, which I welcome, Michelle has always shown herself to be in the lead in this issue. I have asked officials to provide her with a full update of what has been done since she originally raised this issue with the Department back in 2010. I do accept that that was an unfortunate situation and one that we've learnt from.
And would, in your view, the private members' bill have assisted this issue?
Well, certainly the intent of the private members' bill was certainly very honourable, but it was felt better that this could be carried out through actions by the Department rather than what was primary legislation. I accept that that was a balanced argument, which had validity either way. And I remember at the time looking at the bill and thinking, you know, this could go either way. But at that stage, there was assurance given by the Department that the intent of what she was trying to do could be achieved more quickly by means of administrative changes rather than by the long and tortuous process of a private members' bill. And as you know, it can take 2.5 to 3 years to get that through.
I accept that, Minister, but I'm trying to sort of get a direct answer to would the private members' bill have assisted us in dealing with this blight in our community?
Minister, if I can say, it is notable that Professor Marshall hasn't recommended that we now proceed with a similar piece of legislation.
But does that mean that it wouldn't have assisted?
I think that it tells us that she's looked at this issue. She's aware that there was once a proposal for putting this onto a statutory footing. If she felt it would have assisted, she certainly, I would have assumed, made a recommendation to that effect, and she hasn't done so.
Okay, so in terms of the agreement at that time that there would be an administrative system and that there would be a detailed action plan, page 70 of the report that the Health and Social Care Board advised that this was a one-off action plan, and it actually states in the first paragraph, although referred to in correspondence as interim, it is not clear that a final version ever emerged.
Chair, can I make comment about that? Because you've made reference to an action plan in page 13 and page 70, and my understanding and how I'm going to respond to your question is that both are references to the strategic action plan. Those were actions that the Health and Social Care Board agreed to take forward following the intervention of Michelle McElveen and her concern that we weren't collecting and collating relevant information about missing children to help us to understand what was happening to them. So the strategic action plan was developed at that time, and I have to own up my instruction to my staff to make sure that we didn't neglect to document and address the agreements that we had with Ms McElveen at the time. The strategic action plan is given as an appendix to the report, and I think if you look at that you will see that a number of the actions have been completed. There are some that are ongoing, and there's one significant one which I know Professor Marshall has referenced today, which is in relation to the revision of the missing persons guidance and the joint training for police with social workers. So I can certainly comment about that's in relation to the action plan. That still stands. Some of those actions are completed, some are nearing completion, and some is ongoing. So we are continuing to work on the revision of the missing persons, the missing children protocol, and the data collection. We have done a lot of work, and I'm very happy to run through that now as you see fit in relation to the data collection and the missing children's protocol.
I mean, it's the issue that we haven't a final version of an action plan from 2010.
Most of the actions are completed.
But we haven't a final version of the action
ongoing.
plan from 2010.
Well, we updated it in September 2013. I think you'll see that the version in the report, and I will just double check that, is that we provided an update. We took stock, we reviewed ourselves, and updated where we were at September 2013, and that's given in the document that is the appendix to the report.
Well, again, and I will finish on this because I know a number of members want to come in, but Fionnuala, in terms of the board's role in this, again, it's quite clearly in black and white on the report on page 70 under the strategic action plan says, in short, it appears that there has been improvement in data collection, but until recently, this has not been accompanied by analysis and oversight to inform a strategic overview. And it also says, importantly, that we understand that the action plan was not the subject of consultation and not disseminated.
Well, the action plan, as I've said, Chair, was compiled at my instruction to my staff. As a result, it wasn't required by any organisation, by the department. It was an instruction to my staff to make sure that the commitment that we had made to Ms McElveen in response to her concerns about missing children data was taken forward. It was largely considered to be an internal document. However, I am happy to report on it. We updated it in September 13, and I'm certainly very happy to give the committee detail in relation to how we have responded to those commitments.
Yeah, but would you accept it's a piece of work that hasn't been completed then?
Most of the actions in the plan have been completed,
and it was also
some are ongoing.
An action plan, from my understanding, that involved other agencies.
In relation to the protocol and the revision of the protocol, it has involved the police, and we've been working very closely with the police. We have a revised missing children protocol agreed with the police, and we have a commitment from them that once their organisations have approved the protocol, that joint training will be taken forward.
But so it wasn't an internal document, because it also included voluntary organisations.
I suppose, Chair, perhaps I'm not explaining myself terribly well. We weren't asked for an action plan as a response. I instructed my staff as internally to put that together to make sure that we honoured our commitments in that regard. So it wasn't a case of having to report to the department on that action plan on an ongoing basis. And I think that that is why perhaps there is a sense that it has not been regularly updated.
Okay, but I do want to make reference to this again, because it is contrary to what page 69. This one is a meeting between Ms McElveen and officials on the 1st of June 2010 concluded with a commitment to the production of an administrative system for collection, collation and recording of quarterly statistics and the formulation of an action plan on missing children. Seems fairly clear to me. Okay, there's a number
Madam
of
Chair,
members.
could I just clarify a couple of things that have been raised? First of all, as you quoted June 2010, given the fact that the mandate would finish in May 2011, it would have been very difficult to have got a private member's bill on this important issue through in time. The Lord Morrow bill took 2.5 years. So it was a choice between a piece of legislation which had a great degree of validity, but which we thought probably wasn't going to get through, or immediate action by the department to address Ms McElveen's concern. Secondly, we've been throwing a lot of facts and figures at you about the period 2006 to present, and I will provide you with a paper showing every step that was taken in that period to address these issues, because I think it does indicate, unlike Rochdale, Rotherham, Sheffield, etc., and Greater Manchester, that this was being taken very seriously within the department. But had we the knowledge then that we have now, I suspect we'd have done things differently. Hindsight's a wonderful thing. But of course, in the middle of all of this, we pushed through the legislation to form the SPNI, and it was up and running in 2012, which was a major contribution to this issue as well. Hugh was appointed chair, staffed and funded to a level of £750,000 a year. So the quantum of all this would indicate to me, was the department taking this very seriously? Yes, we were. A lot more seriously than elsewhere within the UK. But as it turns out with hindsight, we could have done more.
Yeah, and I will come back on that issue, because the recommendation again in Bernardo's was not talking about the establishment of the Safeguarding Board. It was talking about when the Safeguarding Board was established, that it should, as part of its work plan, consider the issue of child sexual exploitation. So I would make that point.
Hugh, as the chair of the board, can come in on that.
Yes, and I mean, I think I've said to the committee previously, when the board was established in September 2012, it was asked in the first 6 months of existence to produce a strategic and operational plan, which then went out for consultation. One of the 4 priorities that were identified by the Safeguarding Board was child sexual exploitation. It was consulted upon in the period between April and June of 2013, and that was endorsed through the consultation process. Round about the same time, it began to emerge that the police were reporting an issue here, and I think that's a very important point here, that it was actually the safeguarding system itself that was drawing attention to the fact of child sexual exploitation and wanting to respond to it, no other body. And clearly at that particular time, the matter then obviously went in further into the public attention. The board developed its own processes for handling these issues, but was also mindful of the fact that the work, or some of the work, had been delegated to Mrs Marshall.
But Hugh, I know, and I don't want to have this discussion, but I do have to come back to you. The 22 cases came into the public domain as a result of the PSNI trawling their own missing persons processes.
Yes. I'm not saying anything else. What I'm saying is that...
You just said it was as a result of the safeguarding process?
No, it wasn't. No, sorry, excuse me, just a point of clarification. The 22 cases were cases the PSNI analysed, and they were analysing all the cases reported by social services to the PSNI.
Yeah, but they were going through their own internal processes around
Yes,
missing
but what I'm
persons.
saying is these were cases where social services were sufficiently concerned about these young people to contact the PSNI about safeguarding issues relating to those young people.
And if I may clarify, the PSNI are one of the members of the Safeguarding Board. I wasn't trying to say that the Safeguarding Board per se, i.e. myself and the officers, actually identified this as an issue. This was an issue that came from the child protection system.
Okay. I have a number of members. Fergal first.
Thank you very much, Chair, and thank you for your presentation. And whatever about actions were taken, they all ended up with gaps in the information ultimately. And that was being reflected liberally through the Minister's statement to the House yesterday. And I might reflect on them for a second. Not able to establish active numbers of young people, only a rough idea of the extent of CSE. We don't know the full extent of CSE. And all of that gap emerged from inaction, not action. And sufficient enough for Kathleen Marshall to say that as a result of that, some children will have been abused because of that inaction. That is her conclusion. And what's your reaction to that?
I'm not entirely certain, Fergal, I would come to the same conclusion, but...
Right. Sorry, she has authored the report, surely, and...
I mean, I'm not trying for 1 minute to hide behind any issues that have arisen. There's absolutely no doubt that it's better to have a series of tangible actions rather than strategies and timetables. And again, you haven't yet had a chance to see, for understandable reasons, just how seriously this was being taken behind the scenes within the trusts and the board. And lots of actions were taken. But knowing what we now know as a result of Catherine Marshall and other reports, some of which, by the way, were funded by the department. The department gave significant funding to organisations like Barnardo's to critically analyse what we were doing. And that shows that there was no intention to try and hide anything. Why would you spend £130,000 or £200,000 in some cases funding an in-depth investigation if you were trying to hide malpractice or not showing good intent? So therefore, I am content that we were doing a huge amount of work, and had we had the knowledge then we have now, I'm sure we would have done it even more. I'm sure of that.
But the point is, through your public presentation of this to the House and the report itself, that not enough was done.
I accept, Fergal, given the knowledge we have now, yes, that's true.
That not enough was done?
Because we are now much more knowledgeable on this situation than we were 10 years ago.
But not enough was done, is that what you agree?
Well, some of that was because we didn't know enough about this terribly difficult situation.
But we were being asked to find out by the very Barnardo's report that the board funded.
Yes, which was critical of much of some of what we were doing, and we made major changes.
Which wasn't done.
But what I'm trying to say to you is, and I'll let you, Sean, come in here. Once you see the paper trail of what was going on, you will see just how seriously we were taking this. You know, we were taking action. We weren't producing so many plans and wish lists. We were actually on the ground spending a lot of money, a lot of time and effort to deal with a situation which was emerging on a daily basis as being serious. So therefore, unlike other organisations in the rest of the United Kingdom who were simply covering their eyes and denying what's happening and desperately hoping it would go away, we were taking it seriously. And I regret that Catherine Marshall felt in her report that we hadn't done enough. And I think had she seen the full list of what we had done and considered it, she would have been reasonably reassured.
Yes, but and this is perhaps an exaggeration, but you can have activity, and then you can have activity disguised as movement. In this case, we didn't get the result that we wanted, despite advice, it appears to me, that would suggest had we done things differently, we would have got a different result.
Sean.
And surely somebody has to be Minister, not Sean, Minister, has to be held accountable for that.
Well, I don't think it's at that level, and Kathleen Marshall is not indicating for one moment there was any cover-up or any attempt to bury this incredibly important issue.
But, in my view, with respect, that's a red herring. This is people who are employed to do jobs, being responsible for the job. Nobody has accused anybody cover up. And it shouldn't be drawn into this conversation because it isn't part of the conversation and certainly not part of any input from me. I'm only interested in that when people have a responsibility, that they fulfil the job against best advice, and when it doesn't happen, and those who are investigating establish at this committee that people may have been abused as a result of that inaction, then somebody must be held accountable. Who is that?
Well, ultimately, it's the minister responsible, is the person who takes the final criticism. Of course, that in this case is three separate ministers.
Who will you hold accountable?
Well, I don't actually want to do that. I want to look at the lessons learned from the Marshall Report and instigate even more improved policies. But Fergal, when you see the document I'm about to give you, I think any reasonable person looking in that would say, yes, the department took it seriously and took the department, the board and subsequently SBNI, took a whole series of steps which together indicate that this was being taken terribly seriously and a lot of hard work was going in to make our children safer in Northern Ireland than elsewhere within the UK. I'll ask Sean to come in here on the actual technical aspects.
Well, if you don't mind, I don't really want to, because I think I've dealt with that, and that while you can present me with a list, ultimately at the end of the day, I still see the gap that list didn't satisfy. So,
sorry, Fergal, can I maybe just particularly address the gap, because there are some technical issues that I think are significant, and although Kathleen Marshall touched on some of them, there are some other pieces of information that I think might be of assistance to the committee. And I mean, you're talking particularly about the fact that we aren't able to accurately identify the numbers of young people who may be experiencing child sexual exploitation in Northern Ireland today. And I think the inference is that if we had done things that have been recommended in the past, we would be in a position to do so. And I'd like to just address that, if that's possible.
In the context,
can I start by saying
just that Kathleen Marshall has agreed that point? So if you're going to contradict her.
Well, what I'll start by saying is that the department's funding of the Barnardo's research was us putting money into an attempt to try and find out more about child sexual exploitation. Globally, the issue of trying to measure sexual abuse, including child sexual exploitation, is problematic. You can count the number of people who are prosecuted for offences that are relevant to child sexual exploitation. You can also count the number of people who come forward for services as a result of having experienced abuse, and you can add both of those figures together. Neither of those will give you an accurate understanding as to how many children have experienced child sexual exploitation. You can do things that will improve the accuracy of those figures, and those are things like training staff to make them better able to recognise abuse when they see it. Also, public awareness campaigns to encourage people to come forward, having services that people feel might help them so they make themselves known to services. But even doing all of those things, which are the things that Kathleen Marshall has referred we need to continue to do, you will not get an accurate figure. Now, there are experts globally who will tell you you cannot accurately count the number of people who experience sexual abuse. And if I could refer to some experts, I mean, there's David Finkelhor in the United States. No, it is an important point, Fergal, please. This is science. The point is that people will report as adults what they will never disclose as children. And we can see that because if you look at the number, I mean, currently we do know how many young people are receiving a service who've come forward, who've been identified as experiencing child sexual exploitation. Those numbers are a huge distance away from what is speculated may well be the case of the number of victims. The good estimates would say that even the best reporting systems will be 80% out in terms of the numbers of people who actually experience abuse.
I'm going to come in there because I do think, I mean, this is straying off it. I think we are all mindful that this is a complex issue that society is only beginning to come to terms with. But
and if I could just
ultimately, it goes back to the point that both of us, I think,
to summarise in one sentence, no matter how you improve your data collection systems, no matter how much work you do on that, you will never be able to accurately identify how many people are experiencing abuse at a given time.
No, I give that, but I understand that. But, you know, information can be either 100% complete, 90, 80, 70, and we need to see if we can maximise that level. And can I just pull one line out from what you're saying? People who are abused as children sometimes only reported as adults. You need to get to a stage, and the gap on the data collection could have helped in this, a stage where children report abuse as it's happening and feel empowered to do so. And that may help reduce the...
No child protection system in the world has achieved that.
That's okay. And if we want to stay in the status quo...
No. I think we always strive to improve.
Yeah. Minister, can I just finish with this one point? And it's an issue I raised with Kathleen Marshall. And when I heard the Rotherham and Rochdale references, I took issue with her because the comparator, if it was headlined, would potentially make it look as if our problem wasn't as bad as elsewhere, and therefore it would take the context out of context, if you like, in terms of the severity for those involved. And she said that she was only really trying to say that organisationally it wasn't. And it concerns me that you have interpreted in a different way as saying we're not experiencing this, there wasn't the cover-up and the ignoring. Our problem is our problem.
Yeah, Fergal, let me make it clear. One child being sexually abused is one child too many, and it's a horrendous experience for that person for the rest of their life.
Absolutely.
So it's wrong to say that we're feeling complacent because we believe it's not to the same extent as Rochdale or Rotherham. But on sheer scale, there's absolutely no doubt that those two communities have experienced sexual abuse of young people on a different league of numbers to Northern Ireland, and the population of Northern Ireland is bigger than either of those communities, and that's a horrible way to have to say it, but certainly as a percentage it is much smaller in Northern Ireland.
But you see why I feel it important to make reference to that people don't interpret this somehow or other, that simply because that's not happening over here somehow or other.
Yeah, I accept. But what I think was important, the report pointed out, is the significant differences in the form of child sexual exploitation in Northern Ireland, not so that we can lie back and say that, and be proud of ourselves because it's a better situation. It's not. It's important that we address it. But, for instance, had we identified organised gangs in Northern Ireland, well, we had to adopt a series of policies to deal with that, or a particular problem in an ethnic minority. What we know in Northern Ireland is that child sexual exploitation often is involved with loners. It's involved with the party house scene. And, of course, what makes us fundamentally different from the rest of the United Kingdom, there is evidence of those who are involved in paramilitary organisations using that power they have in the community and the fear that if they're predisposed to want to sexually abuse children, they take their power and use it. Now, that makes us significantly different from Rochdale and Rotherham. And we have to know that, because that will require a different emphasis in terms of enforcement to deal with that problem and to get into those communities and ask them to come forward with the information that they need. But the evidence will indicate we're about 120.
But just to be clear, in your reflection of the PSI views that organised paramilitary involvement in child sex exploitation has not been established. So it's another unknown.
No, if you noticed the interviews that were carried out last night by the senior police officer, he said, whilst he couldn't be categorical and say it happened, he said he would not be remotely surprised if the criminal elements within paramilitarism in Northern Ireland, that individuals were not involved directly in using that power.
But this is the gap. These are elements of the gap.
The gap, Fergal, what I will also say is that this information was based on interviews, face-to-face interviews, with young people, some of them a bit older now, who had been directly targeted by paramilitary figures for sexual exploitation, who pleaded with Marshall's report to make this known, that they had been targeted by people they knew to be paramilitary bosses on both sides of the community, who the tap-on-the-shoulder situation arose. Mr. Big, or whatever he likes to call himself, asked girls to remain behind in a bar or a club situation, and they were abused. And everybody in that bar knew the status of that individual. And that is why it is important. Did that then lead to convictions? No, because those young people were absolutely scared, witless, that their names would be revealed to the paramilitaries and they or their families would be targeted. So that's why they felt unable to go to the next step, which we all hope someday they can do, is to go to the courts and the police and to name the individuals who are well known within their communities.
Thank you, Minister. Thank you, Chair.
Kieran, next.
Thanks, Chair. Thanks, Minister, for your statement earlier on. It seemed quite a while. And you may have answered this in your statement. Well, and you paid tribute to the cooperation with the other ministers Wouldn't expect anything other than the best of cooperation from Minister Justice Ford. But can you tell us if a formal structure will be put in place to coordinate the responsibilities of different ministers and departments to address this horrendous problem of child sex exploitation?
Well, I thought that Mr McGimpsey's point, it's a pity he isn't here because I think he could have expanded upon it. I thought that Mr McGimpsey's point was one that should have been considered. And I have promised, and I'll be contacting my colleague in Justice and Education, I've promised to take this forward to see that instead of having a working party or a steering group or whatever, implementation group, that simply has got 3 separate departments ensuring that their particular recommendations are implemented. That should we have a sort of a triumvirate, should we have the 3 of us getting together, representing all the agencies, the police, the court service, the board, there's so many myriads of organisations here, to see that's the best way forward. The Assembly, because of the 1998 Act, tends to act in silos. We tend to have 11 or 12 ministers all looking after their own little private fiefdoms, and that's the structure. And I think it would be wise to come out of those structures at times for the best interests of our community. And if I'm convinced that this is the best way forward to implement the Marshall Report in a way that gives maximum protection to our children, then I'm certainly not going to stay within my silo. I'm going to reach out to the other departments, realising, of course, that we probably are the lead department in that, to work together and have a sort of almost an executive exercise rather than simply us doing our own things. I think we ought to, our community, to look at that. But to be honest, I didn't think about it until Michael suggested it yesterday, and it's going to take a bit of time to work through the consequences of that suggestion. But at least that shows we do listen to points that are made during statements in the Assembly.
So are you saying that there will be a formal structure?
All I'm saying is I am enthusiastic about it. I'm very keen, but I can't speak for John O'Dowd and David Ford. So therefore I have to have buy-in from the other departments.
The fear that if that wasn't the case would be it would just end up as simply passing the buck. Your department didn't do something and gave it forward, and didn't. So a formal structure would be in the best interest.
Yes, and I see a huge degree of merit in that. I think this is far too serious an issue to let it sit on any shelf gathering dust. And I think you would quite rightly condemn me and the other ministers, apart from Mr Ford, of course, if we didn't effectively implement this, because the Marshall Report has taken it on to a different league. But remember, we still got the thematic review of the 22 cases, which I think will add considerably as well to the whole situation. And of course, outside all of this is the OFM DFM report into institutionalised abuse within religious orders. So we are getting information that I think more and more the truth extent of this is coming out. And if I'm not seen to take this seriously, then I expect quite rightly to be ridiculed by you members of this committee.
Sure.
Okay, Pam, sorry, Kieran, Pam, is it on this?
It is,
yes. Kieran, can I just bring Pam on a minute?
Okay, go ahead.
Thank you, Chair, and thanks, Kieran, for letting me in. It was just that I was going to raise the Ministerial Task Force issue as well. And it was just to point out, Minister, that obviously there is an interministerial group already on the domestic and sexual violence issue. I mean, obviously, that to me, this fits exactly in with that, and maybe it could simply be put into that interministerial group, and maybe that this group could be elevated to a higher importance or urgency to deal with the whole issue of domestic and sexual violence, because this is what it is, and it's all part and parcel of the same problem.
Yes, and I think that's a very good option, worth considering, though, of course, that particular group has a wider remit than purely child sexual exploitation, but it could quite neatly dovetail into the work that is being done. I want the best option, but what I can't do is make a commitment for other ministers without having consulted them. They may well chase me on this, I don't know. But what I can say, up to now, we have had very good buy-in from the other departments. And whilst I spoke yesterday as Minister of Health, I was also speaking on behalf of the other 2 ministers in the sense that they had seen the report and had agreed strongly with the thrust of what was being said and hadn't raised any concerns about the way that we were going forward.
Okay. You finished?
Kieran, yes, go ahead. Oh, sorry.
Could I just say, I'm just thinking too, I'm not sure which ministers exactly are part of that domestic and sexual violence group, but if the Education Minister isn't part of that, then he could be made part of it? Does it include all?
I think any group that might be formed would have to have the Minister for Education. I mean, I think it's clear from Professor Marshall's recommendations.
Would the Minister for Education be involved in this group that already exists?
I would need to check. No, we don't believe so.
No, so I think that would be imperative, because obviously it's okay investigating and examining and questioning what's gone on before, but this is a problem which is not going to go away. It has to be dealt with, and I think that's one of the most important things coming out of this Marshall report are these recommendations, and it's actually giving us ways to actually tackle the problem and to raise awareness and to enable our children to grow up hopefully more safely, but we need educated children and adults.
It's worth saying that Kathleen Marshall didn't suggest this, but this is Marshall Plus, and it shows the benefit of an assembly where people come up with what I think are very good ideas. So that this has been taken forward as a matter of urgency, and I'd like to think that given the dates that we've set for all of these, that this is going to ruin a few officials' Christmases, I can tell you, such as the urgency of it, that we are taking this very seriously and will be coming back to you very quickly with the outcomes of this.
I think if it protects children, it'll be worth it. Absolutely.
It's worth it, yes, it is.
Kieran.
Just in conclusion, Minister, what support mechanisms are in place for young people who have been victims of sexual exploitation, and how will you take into account that some people, and this has been mentioned before, some people may not ever appreciate that they have been victims at the time and may only realise this later on in life? Go ahead.
Yeah. I'm going to hand over to Fionnuala in a moment, who will give some detail to this. But currently, we have a number of young people who, through sharing of information between PSNI, social services, and Barnardo's, we've identified them as being at significant risk. All of those young people are in receipt of a service, and it was interesting, actually, that I don't know if committee members are aware that today Ofsted published a report on this very issue of child sexual exploitation, and they particularly recommended a model of working to support young people who are victims of child sexual exploitation, and they were critical of the fact that in many local authorities in England this isn't the model that's adopted, and it's that these young people should be co-worked with an ascribed social worker and be in receipt of a specialist service, and that's not necessarily the way it's done in other parts of the UK, and that's been a criticism. That is the way young people are currently being supported. So the young people who are victims of child sexual exploitation or who have been identified as being at significant risk of child sexual exploitation, who are known to services, currently have both a social worker, and they're referred to the Safe Choices programme, which the department initially funded, as the Minister said, and the board subsequently is funded. In relation to adults, there are a range of services that can support adults, both in the statutory and voluntary sector. Many adults who've experienced sexual abuse, unfortunately, will go on to have lifelong consequences, often with regard to their mental health, sometimes with regard to addiction, and they are accessing those services. We also fund some specific specialist services. No, Mr McKinney, unfortunately not here, because I know he's got a strong association, particularly with the Nexus Institute, which is one of the key services for supporting them. Fionnuala, would you like to add anything to that?
Can I just say that we have a wide range of services in addition to what Sean has said. We have the therapeutic services, mental health services, services linked to drugs and alcohol. Our annual investment in the CAMS teams, for instance, is currently 19 million, and more recently we have invested another £2 million in the development of primary mental health workers' teams and crisis response services. And we now have a sexual assault referral service, or SARC as it's known, which provides a range of services for men, women, children and young people who have been sexually abused, assaulted or raped. And that, no matter when this happens, and the service is available 24 hours a day, 365 days a year, and it's provided by a dedicated professional and highly trained team. And I think that, again, in addition to the paper that we're giving you, indicates just how seriously we have been taking this. And in very difficult financial times, the amount of money we have been investing in what is an increasingly difficult issue. Fionnuala, do you want to add to that?
I don't think there's an awful lot more to add, just to emphasise that the support services are there. There's a full range of support services. It could range from one-to-one counselling, help with some of the trauma that the victims have experienced. It could be through our child and adolescent mental health services or adult psychology services, and the ministers referred to addiction services as well. So there is a range of services available to people who have suffered trauma in their lives, including child sexual exploitation or sexual abuse.
Sorry, I do think the SARC deserves a special mention and recognition because it's recognised as being probably the best in the UK.
No, and I mean the committee has
I mean,
visited.
I know the committee are well familiar with it, but that is a service that is absolutely relevant to this issue. It's a service which has taken many years to plan, design and build. So I do think it's relevant to the fact that we have been responding to this issue. And it is seen as class-leading in the UK.
We are aware of the very expert and valuable services across this issue and other issues, and that goes without saying. Kieran?
Just the tail end of the question was, what plans does the Minister have to factor all of this information into the delivery of a much more and better improved mental health service? I asked this question to Mrs. Kathleen Marshall, and her Sheila Taylor answered by saying, and she was adamant, that more resources must go into mental health.
Well, Kieran,
I think that's what you instigated there when your answer.
That's one of the most difficult questions we're going to face all day, because I have spent all day today and will be spending all of tonight firefighting with budget issues. And everywhere I look, there are pressures on budgets, and there are very, very hurt people out there who are being affected by budget reductions. And I've had to appear at mental health conferences to speak to those at the front line. I can't sit here and promise a radical change in the structure of mental health provision in Northern Ireland. We all accept that by UK standards we're spending less than we'd want to. But remember, social services in the UK mainland are a council responsibility. They can go to the ratepayer or the council taxpayer and look for extra money. Mental health services are battling against the big items, the cancer units, the heart disease, the domiciliary care and all of the other issues. And basically mental health next year will get its share, commensurate share of the 150 million. It's not 200 million, it's 150 million, because we have to make savings of 50 million from organisations such as the Fire Service, the Public Health Agency, and that's going to be very painful. So, you know, what Kathleen Marshall recommends, yes, we do need to give this more in the way of resource, but it is very difficult to do that. But I can say that the most important piece of legislation that's coming before this committee is the Mental Health and Incapacity Bill. And we're hoping that that will be a vehicle to put up a very strong case for increased funding. Because one thing I can tell you, I am not happy as Minister with the level of resourcing for mental health in Northern Ireland. I am not. But how on earth we can balance the numerous activities of the health service and social services and mental health is extraordinarily difficult. And if you'd seen some of the text messages, emails and phone calls I've had this morning from every corner of Northern Ireland about funding issues, you maybe wouldn't feel as relaxed as you
I
would.
have to bring it back round to the subject here,
Right.
folks.
Okay, that's fine. Thank you, Mr.
Okay,
Thank you,
Rose
Chair.
is next.
Okay, can I just ask the Minister, in relation to this report, there have been previous reports and we have gone into the detail in this session, previous session, so I won't labour the point, but I would just like to ask the Minister what will he do differently to ensure that there is change in relation to protecting children who are victims of child exploitation, given the fact that we've had recommendations from previous reports that were ignored and they were left to lie and treated disgracefully, I would say, ignored, I would say would be the best way of putting it. So I would just like to know what would give us confidence to move forward.
Well, first of all, as I said publicly in the Assembly, I will not be doing anything radically differently to my predecessor. I had the highest regard for his professionalism and his ability as Minister, and I watched very carefully from this table and from the back bench of the Assembly what he was doing, and on almost every occasion I said to myself I would have done exactly the same. But what am I going to do now in the situation that I've been in this post for 56 days, and I have to tell you it feels like 56 months. It has been absolutely frenetic, to put it mildly, what the activity that's been going on from all the issues. What we're going to do differently is that the timetable that I've set officials is not only challenging, it's stretching. I'm expecting responses back within months. I mean, small numbers of months, 2 and 3 months. Therefore, by the end of January or March, depending on the report, I will have the response from the various elements of my department. And we will be keeping this committee up to date with the progress. And I would expect to get a letter from your clerks if we overshoot on this, saying, where is this material? In the same way, for instance, that the individual funding requirement issue is to be in my table in 2 weeks, and I've committed to reporting back when that's available. I'm not going to let that sit on the long finger. I don't want a knee-jerk reaction. I want to get back that information very quickly so we can have a very coherent response. But equally, if we can get buy-in to a more wider framework development, then no one would be happier than myself. Now, we come from very different legal backgrounds, but I have no baggage here. And the aim of all us should be what can we do to protect all of our children? And let's set aside any differences we have in terms of political outcomes or indeed budgets. And let's do what's best for them. So I'm going to act on that immediately, because I think that is a very good suggestion. And I've always benefited, having sat on this committee for 5 years. I would have to say this, that I always felt that the contribution of this committee can be very, very significant. And I want everyone to work together very quickly to ensure that we get rapid buy-in to this and get it off the ground. Now, what I can't say in advance of that is I'm going to do X, Y and Z, because I need reports coming back from officials as to how they feel the best way is to deal with this. But you have my personal pledge that anything that I can do to help eliminate the scourge of child sexual exploitation in Northern Ireland, I am committed to. Because I have seen and read things within this last few weeks in the lead up to the Marshall Report. A, I didn't understand, and B, when it was explained to me, I couldn't believe they existed. It has been horrendous to hear some of the background material about what's going on. And I don't want my grandchildren and my great-grandchildren to be exposed to that. And the one thing that really worries me is the internet and the power of children having access to absolutely repugnant material. And I think we need to get the entire Assembly and the Executive bought in to a programme of making the cyberspace safe for our children. Because at the minute, the law of the jungle applies. And you would not believe, and I didn't believe until I read about it, what our children have been exposed to on a daily basis in this society in little Northern Ireland. And I can tell you that my colleague, Léir Varadkar, in Dublin, is equally worried about the situation, and his colleague, James Riley, are really, really worried about, on the island of Ireland, how bad the situation is. And until I did think if we can't crack that, then some of what we're doing here is only putting a finger in the dike. And that's my honest view on it. It's dreadful.
Okay, well, I mean, I look forward to seeing that approach going forward. If I could just draw your attention to remarks that you made yesterday in response to my question, whenever you delivered your statement, Minister, what you said was that you spoke in the present tense, you said that there were evil men exploiting children in West Belfast. That's my constituency, yes. And I am very concerned about this. You also implied that my community is protecting people who are exploiting children. Now, I would just like to know what is it based on? What is your information about these evil men? And more seriously, who are the children who you say are being exploited, and present tense as you used? I would also like to know that what way are you approaching this in terms of other constituencies, or is your focus just on West Belfast? Professor Marshall didn't single out any community. She didn't even suggest that there was any more prevalence of danger for children in anywhere more so than anywhere else in the north. So I'm surprised that you have such a focus. Now, you do have history of attacking my constituents in West Belfast verbally, and I am very concerned about that. So I would like you to address what I have said, in that what information do you have and what are you doing about it? What have you done about it?
Right. Well, first of all, Madam Chair, I'm glad you brought up that last issue, because you will recall, and I've looked at the transcript of that previous hearing, that the line that I used, you very quickly picked up on. And at the end of that hearing, I made it absolutely clear what I meant by that comment.
I think, sorry, the member is referring to the debate in the Assembly yesterday.
But also I think you're alluding to the comment I made 3 weeks ago at this.
I'm not referring to that.
You're not referring to that?
No, I'm referring to your comments.
Well, the evidence on the West Belfast was the very clear evidence of Maria Cahill. It was quite clear by her extensive interviews in the media that she was referring to West Belfast largely as the area where she was abused by known Republican paramilitaries. Now, I was quoting that because you were a West Belfast representative raising the issue, and I was making the point that in your community there are people who are aware of strong men, big men as they call themselves, who are linked to paramilitaries or who are believed to be linked to paramilitaries, who have been getting away with child sexual abuse in that constituency and seem to have been immune from prosecution because individuals who were aware of them did not bring that information forward. And what I was hoping yesterday would have happened is that one of the members of your group would have come forward and made it absolutely clear that if anybody has information about that activity in West Belfast or East Belfast or any other part of Northern Ireland, that they, even if it's old information, even if it's retrospective, that they would bring this forward to the police and the social services immediately. And I was disappointed that none of those who spoke made that pledge. Is there a commitment by public representatives who would well know some of these individuals? Are they prepared to bring that information forward to the authorities now, given the fact that all of us are meant to be supporting policing and justice?
I mean, I think, Minister, every one of us around this table are very clear and unequivocal about getting that support in place and ensuring that those processes are in place. And that's the very reason why we're having such an in-depth focus on this piece of work, and that goes without saying. But, you know, would you accept by saying sweeping statements like, you know, these evil men in West Belfast, that it's a sweeping generalisation, which in my view is very much unfounded?
Well, I mean, the Maria Cahill comments were a lot worse than these evil men in West Belfast.
These are your comments I'm talking about?
No, I'm talking about the comments that she made, and unfortunately the Marshall report was too far down the road, in my opinion, to have adequately dealt with the startling revelations that lady very bravely made in the media, and she specifically referred to West Belfast. But could I say, to make it absolutely clear, it is that the Marshall report makes it clear that this is happening throughout Northern Ireland. It's happening in areas where there has been in the past a lack of willingness to support the forces of law and order, and that would apply to nationalist areas as well as areas which are under the control of loyalist paramilitaries. And she did not identify any particular group, but what she did have was a series of people pleading with her to make this public, that they had been molested by those identified as paramilitaries. She didn't say that paramilitaries had an active programme of CSE. She was saying those who were loyalist paramilitaries who had a predisposition to attack
girls.
I
think did you want to come back on that? Yes. Sorry, I'll allow you to come back for it. Go ahead.
Well, I will just say this. I live and work in West Belfast, and I know the people who live and work in West Belfast who've lived their lives there. What you are saying does not reflect the people. We are opposed to any child exploitation or child abuse, and the people I know would stand strong against that. You might have one person who is making statements or allegations, but that does not constitute a case for people in West Belfast who are unnamed. So I will just say it again, anybody with any information should go to the police, the social services, whatever authorities are relevant, and that's what they should do if they've got information about anybody abusing children. I can't make it any clearer than that. It has been made that clear, and you've insulted my community to suggest that anybody in my community would see it differently.
Well, first of all, would I ask you, is that retrospective information held about past activities of Republican paramilitaries? Would you urge people to come forward?
Any knowledge of abuse of children should be taken to the relevant authority.
Well, that's the information I was asking for yesterday, and if I've offended the people of West Belfast, well then Ms Cahill has certainly offended the people of West Belfast, because she has been very specific about allegations about individuals in West Belfast who have been committing these terrible crimes.
With respect, Minister, you have got responsibility for the health and well-being of the people of West Belfast. Nobody else. You are the Minister. You have a duty to apologise.
And that's why I think it's unfortunate you didn't give me the opportunity to clarify the West Belfast comment last time. But I take your ruling, Madam Chair. All I can say is I felt that at the end of that, and I felt that you accepted it at the end, that I made it absolutely clear I could be referring to anywhere in Northern Ireland by that.
Sorry, when I talked about was stereotypes, but I mean there has been. I think it's on this issue and a very quick.
Yes, Minister, you have to say you seem fixated in West Belfast. In the question I asked you yesterday, I mentioned all constituencies. And with respect, there was an incident in your own constituency not that many years ago where an individual with a fairly high public profile was actually charged and convicted, if my knowledge is right, and I didn't hear you coming out then so strongly as you're coming out about particular issues now. So, you know, consistency is something I think that is to be admired. But I think in this issue, you haven't been as consistent as you might have been, and I would just make that point. And if you want to discuss it with me afterwards...
But certainly, I'm not aware of what you're referring to, but I've no doubt that you can provide me with detail.
In local press and indeed in national press.
Well, I'd be very interested.
And I'm sure you have been aware of it.
Okay, and what I'm going to say at this point, I think the point has been made well, clearly, loudly by the member. I hope that the Minister, I know that it has been raised as a point of order too on the floor of the House, and that the Hansard report has been reflected, and hopefully that will be brought back to the floor of the House. But I would urge the Minister to take that consideration to the member's views that has been made today. Okay. Joanne is next.
Thank you, Chair. Minister, during our frank discussions with Kathleen Marshall, there were so many questions raised, and we're still looking for so many answers. But Kathleen spoke about interviewing people who don't normally have a voice, as she put it, and she was referenced ambulance drivers, people that have information to come forward about child sexual abuse. And I very much welcome this and the detail that she went into about those that she felt didn't have a voice. So I noted with interest during your briefing to us, you spoke about a clear reporting pathway 24/7. Now, if you just maybe clarify that, because Kathleen raised, for example, taxi drivers that had valuable information that they had witnessed, but not knowing who to contact outside normal working hours, where to go to give that information. So when you speak of clear reporting pathways 24/7, are those with reference to people that have been, children that have been abused, or people like taxi drivers, for example, that want to report it but don't know how to or don't know what's available? When do you envisage this happening, and how do those people with valuable information, how do they know where to go with this 24/7 that you're referring to?
I'm going to ask Sean to come in on this, but John, can I thank you last night? I noticed you on the media, in my opinion, very responsibly reacting to this report and giving a balanced view on it. And can I just say that, I don't often say this, but I felt the media did themselves a lot of credit by the way that they gave this report a balanced consideration, and rather than homing in on one or two major issues and trying to indicate the scale and the nature of the problem, which is such a serious one. So I'm hoping that that will set the trend for the future, because I felt that people, having watched the media and read the papers this morning, would have got a very clear indication of the nature and extent of the problem and what was being done about it. So I thank you for that, but I think Sean has the technical information on this.
Yeah, it's a really, really good point, because it highlights a number of aspects of this abuse. I mean, the first thing, it's an example of how our understanding of the nature of child sexual exploitation and what we can do about it has changed. Certainly going back a number of years ago, people were focused very much purely on professional service providers, whereas increasingly there's a recognition, Kathleen Marshall has highlighted this, that this is a challenge to everyone in society. And there are some people in society, through their jobs, may have particular opportunities to intervene. Taxi drivers are one group, ambulance drivers are another, but there can also be people who are working in fast food outlets, there are people who are working in the hotel and hospitality industry, all of whom may just be in the right place at the right time to see something that needs to be addressed. Both police and social services have 24/7 response opportunities available to people. We have an out-of-hours social work service, and obviously the police service is a blue light service, so they can be contacted 24/7, certainly out of hours. But the key behind your question is people knowing what to do. At that point, I think I'd hand over to Hugh, because one of the things that the SBNI has been leading on, certainly plans to continue on, is to try and promote awareness so people can recognise this and then know what to do about it.
John, just before you hand over to Hugh, I got the impression from Kathleen, obviously these were valuable witnesses that she spoke of, people that don't normally have a voice, but I got the impression from her during her presentation that she felt, speaking to them, the service was not, they felt they didn't know where to turn, how to get that information out. You said you have social workers' details 24/7, but those people that are witnessed there and then, how do they know where to go, and how do they know that that mechanism exists?
Well, I think that's exactly why I was going to refer to you, because he's been leading a campaign which is about trying to make sure that people do know where to turn and what the mechanisms are.
But I got the impression from Kathleen it was scant, there wasn't.
I think certainly this is, as I said, I mean, if you were to go back a couple of years ago, no one was thinking that there was a possibility that people like taxi drivers could play a crucial role. We're starting to recognise that. So inevitably there's going to be a lag, but that's why it's important that there is a public information campaign.
I mean, if I just may add a few bits to this, I mean, I think one of the very first things that the Safeguarding Board, and by the Safeguarding Board I mean all of the membership of the Safeguarding Board, not just the officers, I think one of the first things that we decided we would wish to do was actually raise the knowledge about child sexual exploitation, because we thought that to the vast majority of citizens it meant nothing, meant little. So essentially what we've been working on over the past year is an attempt to talk to a range of people, from parents, actually also into what Sean refers to, the nighttime economies. So we're basically trying to talk to taxi drivers, trying to talk to the hospitality trade, trying to get awareness out.
How are you doing that, Hugh? How are you getting that information out?
What we're doing is we're actually carrying campaigns to those groups. So we've worked with taxi companies.
You're contacting taxi companies?
We've worked with taxi companies. We've worked with the sort of licensing trade. We've actually worked more recently in this last 2 weeks. We've went across the province and actually had community events in each of the 5 trust areas, trying to raise and talk to community representatives.
Is that a one-off measure? Is that an ongoing? Because taxi drivers change, people change jobs, so will that be ongoing?
You're absolutely right. I mean, this won't work if it's a one-off measure. One of the things that we're really keen to do now, and I think the Minister's mentioned it, is that we look forward to actually keeping this campaign going. We need to make sure that it's a drip to those organisations. I think Kathleen Marshall's comments about ambulance drivers was an insight for me, and I think clearly we need to do something with that and rise to that. I think the other thing that we are planning to do is actually contained in one of the recommendations, and that's actually take out an education and training campaign for professional staff. And I think the last thing that I want to say to you about this is, again, back to Kathleen's message about children themselves. What we've been trying to do in recent months is actually find a way of talking to children to make sure that when we actually come to do the messaging to them, that it actually is relevant to them, it has some meaningfulness, that it's done in a way that actually they're likely to access. So although we haven't been bringing anything out in that regard as yet, we've been doing the planning behind the scenes.
So you're saying, for example, taxi companies will be given specific details, who to contact out of hours when they spot a vulnerable child, because Kathleen alluded that they didn't know, and that valuable information that could essentially save a vulnerable child's life was being lost because after 5 o'clock they did not know who to contact, which numbers to contact, how to get in touch. So you're categorically saying that that information will be widely available out there and they will have the numbers and know who to contact?
Well, can I say that will be our intention to work towards? If you're asking me, have we done at this moment in time, what we have done at this moment in time is actually work directly with taxi drivers and taxi companies to make them aware of the question of CSE, to make them great. And basically the question now that you're raising is, I think, will be an ongoing strand of the work that we do.
And it will be
yes.
Timescales. Have you envisaged any timescales? And you mentioned ambulance drivers that you weren't aware of,
yes.
And certainly that was very, very valuable for us as a committee to hear. Kathleen referred to ambulance drivers well and the vital information that they have. What sort of timescale are you?
Well, I think, again, the board would need, and the board officers in particular, would need to plan this. But I imagine what we're talking about is the very early months of 2015.
Okay, thanks, Chair.
Okay, do you want final? Speaker Gordon.
Thanks, Chair, and thanks, Minister and panel, for coming along. Minister, we appreciate you have a lot of priorities at the moment. I know one of them is trying to keep services in Northdown going, and we appreciate all your efforts on that. But how are you going to ensure that this report is kept at the top of your in-tray and doesn't become buried in all the other priorities? How are you going to progress it, update us, and make sure that it's actioned thoroughly within your term? And we appreciate you're new into the job and you've a lot on, but this needs to be followed through.
Well, first of all, I think the public and MLAs will make very certain that if we were ever to deviate away from making this a priority, we'll be very quickly told about it. I think, given the issues that I have raised earlier about recent TV documentaries, this is very much at the forefront of public opinion to deal with this issue. And the more that comes out from that programme, I think we will find that there's much more to be found out and ascertained. I am personally committed to it because I must say I find it, it's very hurtful to hear. I think hurtful to me was the wrong phrase. It's frightening and shocking when I hear what has been going on in our society amongst vulnerable, particularly young girls. Some of them in care, some of them not. Things that are unimaginable that I, as a parent or a grandparent, could ever believe was happening. So therefore, I'm personally committed to this. Lives could be ruined, destroyed by sexual exploitation. And we owe it to our community to get this right, and we certainly owe it to our community that nothing that happened, say, in the rest of the United Kingdom, that extent ever occurs here. But I'm not resting in my laurels. I know that even, say the figure of 120 is a conservative, that's 120 lives destroyed, absolutely destroyed by sexual abuse. That is 120 too many, and I want to make absolutely certain that we drive those figures down. Now, can we eliminate it from Northern Ireland? I think that's almost impossible. Unfortunately, the way that society is moving, I just don't believe we can achieve that. But we have to make Northern Ireland a cold house for those who would exploit our children, and to make it very clear that everyone in society is committed to reporting that to the police and social services, that there's no hiding place for these individuals.
Will the proposed actions be influenced anyway by the constraints of the budget?
Well, budgets are an issue, though I'd have to say that in the overall scale of things, Kathleen Marshall's recommendations aren't going to break the budget, as it were. They're not on that scale. And we already have committed ourselves to the SBNI and its funding. And we have committed ourselves that when Hugh retires, that we're going to take action then to find another proactive chair who's going to take this forward. So I think that's more or less guaranteed. That will continue, and we will continue to fund social services. The police, in their very difficult situation, are giving this real priority. But it requires the three ministers to get together and to instruct officials and always to keep the funding for this at the top of the league, because the costs, and I hate to talk about costs, but the cost of this goes wrong and some young person's life is destroyed in terms of future care and counselling and help can be extremely high. We need to, and I don't even want to, we'll pay that, and I don't even want to think about it, but we have to ensure that as few people as possible end up needing that care. So in the long term, it's to the health of our community that we do indeed tackle this issue vigorously.
Thanks, Minister. Thanks,
Okay,
Chair.
thank you, Gordon. And finally, George.
Just very briefly, I must say from my own point of view that today has been very, very informative on both presentations, and Catherine and her team are to be commended, and Jim and his team as well. It was an excellent presentation. And from Jim's point of view, I've known Jim for quite a few years, quite a long time, and I've always found Jim to be a very sincere and credible human being. And any allegations against him today, I think, should be refuted. I mean, he did spell out that he was only speaking from Marie Cappell's point of view, and I think the matter should rest there, as far as I'm concerned. Both he and his team and Catherine has given us an excellent presentation, very, very, very worthwhile from my point of view as a new member of this committee to hear the sincere people that already have spoken here today, from Jim's point of view and from Catherine's point of view.
Again, a point of order has been raised, and we will reflect on that.
Yes.
But thank you for that.
Is that the last question, Madam Chair?
Yes.
Okay. First of all, can I thank you for agreeing to meet us? I think it's nearly 6 o'clock. I can't see.
It is.
So the members have clearly taken this seriously, and I welcome that fact that the amount of probing you've given me and you've given Catherine Marshall. Could I say, just as to summarise, this is an issue throughout Northern Ireland. It's an issue in rural communities, it's an issue in Belfast, it's an issue in Londonderry, in all of the major towns and villages. It would be wrong to say that it's a particular issue to a particular community. It is not. It is one that we as society as a whole are responsible for, and that we as MLAs and as public representatives can do a lot to make certain that our constituents feel happy about coming forward. Please tell me that unless there's a flow of information, reliable information and data and intelligence about this, it makes it very difficult to prosecute those who are involved in something which by its very nature can be clandestine and can be done in a way that many people don't even know it exists. So therefore, I don't want to underestimate the difficulties we have. Equally, I'm very minded of the fact that social work in Northern Ireland is one of the most thankless tasks imaginable. And that on 999 occasions when the Sean staff get it right and nobody's interested, when occasionally there's a slip-up, there's mass press coverage. And I don't want to say anything today which will discourage those who are at the coalface trying desperately to get on top of this difficult issue, and who have to carry home with them at night some terrible memories of what they've just heard. I think that is a desperately difficult role. So I have been trying to say that staff over this last 9 years have been making a real effort, and I hope when you get my paper that you will agree they've made a real effort. But given the knowledge that I now have and the team have, we can do things better and will do things better. And if there were mistakes in the past, we have to learn from those. But I am determined to make certain that as few young people in Northern Ireland as possible are exposed to this dreadful, dreadful crime. I think Sean wants to say a last comment.
Just one point, and I really appeal for this not to be misunderstood. I mean, CSE is clearly a poison in our society, but I wouldn't want the committee, or indeed the public, to believe it dwarfs other issues connected with child protection. Quite rightly, this is something you're all concerned about, but it's worth pointing out we're receiving 40,000 referrals to children's services every year. 4,000 of those become child protection cases, and amongst those, the majority are not actually about CSE. They're about physical abuse, they're about emotional abuse, they're about neglect, and they're about sexual abuse that doesn't meet the definition of CSE. And we shouldn't forget that probably the majority of children who are sexually abused will be sexually abused within their own families. I think 45% is the probable figure for women who experience sexual abuse as children will experience that abuse at the hands of their father. It's important that we're looking at CSE. It's new, it's changing. We need to know more about it. We need to do more about it. But we do need to realise that, unfortunately, this is not the only challenge facing child protection services. And I just want to ask members to bear that in mind.
Okay. Can I thank you all for your generous time today? Thank you. Members, I'm going to take a 5-minute break here. No members are.
Chair, we suggest we defer the business till next week.
There's some things we have to deal with, but there's a number of items that were. One of the items in terms of the Assembly research that we're going to defer, and we're going to discuss the regional task force. There's SL1s that we need to go through and get up to.
George, is not moved to get to Limavady for a meeting that's
next week, just given time constraints, which was a briefing by the Assembly researcher.
Thank her patience and perseverance for sitting outside.
Absolutely, absolutely. Item 8, members, is the Regional Task Force on Emergency Care. It's a progress update. Refer members to page 75 of your meeting folder and page 215 of the tabled meeting folders. Departmental officials are here today to brief members on the work of the task group to date and the next key steps this winter. I do, however, want to advise members that the department did actually agree the date for this briefing over 2 months ago, and they've only managed to send the committee the briefing paper this morning. We've had no explanation for the delay, and I would also like to make the point that yesterday the Minister sent out to the Assembly a written statement on the work of the task group, which was embargoed until 11:30 today, and he also issued press release to the media, and this was done before
sending the committee the briefing paper as it was requested. So I have a number of concerns around that departmental approach. I do think it shows a lack of respect for the committee and our scrutiny role, because it does seem that the department prioritised getting out a written statement and sending out a press release ahead of providing papers to the committee. Certainly feels like that. It gave us as a committee certainly no time to read the briefing paper before we've had the evidence session today on which is a key topic of public concern and concern to this committee. So I'm suggesting, members, that we don't bring the witnesses to the table today, but that we write to the Minister to express that we are disappointed and that we would seek an explanation for the late paper, and that we would reschedule this session for the 3rd of December. Are members in agreement?
Agreed.
With that? Okay, thank you for your cooperation in that. So item 9, members, is SR 2014-261, the Misuse of Drugs Amendment number 3 regulations. It's on page 80 of the meeting folder. I just want to remind members that the committee had considered and approved the SL1 for the rule on our meeting on the 15th of October. There have been no changes to the policy content since the SL1 was submitted to the committee and to the examiner of statutory rules. There's no issues that hasn't been raised there. So are members content with the statutory rule? Yes. If so, then can I just put the proposal that the Committee for Health, Social Services and Public Safety has considered SR 2014 number 261, the Misuse of Drugs Amendment number 3, and has no objection to the rule.
Great.
Item 10 is an SR 2014, the Misuse of Drugs Designation Amendment number 3 order. Page 87 of your meeting folder. We had again considered and approved the SL1 for the rule at our meeting on the 15th of October 2014, and again there's been no changes to the policy content since it was admitted. So if members are content in putting the motion, the Committee for Health, Social Services and Public Safety has considered SR 2014 number 262, the Misuse of Drugs Designation Amendment number 3, and has no objection to the rule.
Great.
Item 11 is another SR 2014 number 267, which is the Health and Social Care Disciplinary Procedures Regulations 2014. It's on page 94 of your meeting folder. Again, advising members that the Examiner of Statutory Rules has not formally reported on this rule. However, he has indicated that he has an issue to raise. So I'm advising members then that we will place the item on the agenda for consideration at next week's meeting when the position's clearer. And item 12 is an SL1, the Misuse of Drugs Regulations 2014, on page 111 of the meeting folder. Advising members that the Department is proposing to make a statutory rule to allow for the provision of aluminium foil by persons employed or engaged in the lawful provision of drug treatment services. Such provision would be permitted as part of structured steps to get individuals off drugs, whether for the purpose of getting them into treatment in the first place or as part of their treatment plan. Without this amendment, the provision of foil to drug users would be an offence under Section 9A of the Misuse of Drugs Act 1971. So I'm informing members that relevant bodies have been consulted and they are supportive of making foil available in the North. So are members content?
Keep her going.
Item 13 is the Forward Work Programme. It's a revised Forward Work Programme which is now at page 118 of your meeting folder. Just want to advise members that the Department is not yet in a position to brief members on the cancer drugs issue. Therefore, all the briefings that were scheduled on this issue for the 26th of November have been postponed. I'm informing members that the Clerk is now actively trying to secure an alternative date in January 2014 to suit the organisations and the Department.
Great.
Is the Department is the problem here? In terms of
yes, Chair. The Department has advised that they're not in a position to brief the committee on the issue before Christmas, and I've asked them to come back to me with a date of when they are in a position. I'm still awaiting that date.
I would be concerned, Chair, because this deal that was struck last January is now a year. Will be a year. and we're losing out on the opportunities within that deal. And if we now run into next year when they're discussing it and then going to brief us at that point, then we're into another year of lost opportunity. Now, it's the view of those involved in the PPRS scheme that there are enormous opportunities here. It's the view of the department. Sorry, we don't have a view from the department, but it's my understanding that we could allow greater access to these drugs if we signed up meaningfully to this deal. I don't accept that the department doesn't have a view, and I think we should push for it sooner.
I'm just suggesting to the clerk that we can and should reflect that view back to the department, coming from today's discussion on it.
So, Chair, do you want to request the briefing happens?
Well, we have requested the briefing, and I think we're stressing the urgency around the situation.
Yeah, I mean, I don't think we pushed the department into coming. We obviously, this is an issue that's been ongoing. It affects all of our constituencies and large numbers within our constituencies. It's a gross inequality that has resulted in us not having access to cancer drugs, and look, we need some answers to that. And I think we've been probably quite liberal in terms of our time in relation to just asking them to come and putting it somewhere in the diary. And I would worry that the departments take advantage of our good nature.
Yeah, well, I think that the importance of the issue and the urgency of the situation should be reflected back to the department.
And then can we call?
Can we
call them?
Call them to the committee?
Could we?
Well, of course. I mean, and I don't expect if the department were given a specific date that they would. I mean, it's up to the minister ultimately to deciding the date for a briefing. But certainly, maybe in the first instance, to go back to the department, ask them for their preferred date, and I could bring that back to the committee for consideration next week, and then take any further steps at that point.
We reflect on that next week then in the context of calling them. Thank you.
Okay, thank you. Next item is matters arising. There's 17 items there, but I'm just going to draw your attention to several of them. Page 122 is a response from the department regarding the committee's review of waiting times. I have to say it's a very brief response to what we would all be aware is a very complex issue, and the Minister does seem to be supportive of the committee's recommendations, but there aren't any timescales for taking forward any of the issues that we raised. So I'm seeking agreement, members, to invite officials to brief the committee on the department's progress and time frame for implementation of the recommendations in the new year, and to request that the briefing paper for the session sets out in detail the progress timescales under each of the recommendations that we made. Members in agreement with that?
Yeah.
Thank you. Page 128 is a response from the department providing an update on the outcomes framework for transforming your care. Just want to advise members that we have forwarded this information to the expert advisor for consideration. Page 136 is a response from the department providing information on how the recommendations that came out of the Cherry Tree House review are being taken forward. Seeking agreement to forward the correspondence to Mr Hanna, who raised the issue.
Great. Okay.
Also seeking agreement to write to the department to request a copy of the interim progress reports, which were submitted by each responsible organisation as soon as they're available.
Great.
Pages 137 to 158 are responses from the department and correspondence from the committee in relation to the stakeholders event. I'm seeking agreement to forward the responses to the groups who raised each of the issues. Now seeking agreement to note the remaining correspondence unless members have any comments.
Is this the general correspondence or matters arising?
It's matters arising.
That's right, it's correspondence.
Correspondence is next. Again, there's 18 items of correspondence. I'm going to just focus on a few of them. Page 198 is correspondence the Chair of the Education Committee has had, asking whether the Health Committee would host a joint stakeholder event to look at the availability of health services which provide access to the education curriculum for children with special education need. I'm asking members whether they would be willing to participate in the proposed stakeholder event.
Yeah, great.
Page 200 is correspondence from Moyle District Council
regarding the temporary closure of Dalriada Hospital and seeking a meeting with the committee. Seeking agreement that we write back to Moyle, advising them that obviously this is an issue of major concern and one that is indeed a regional issue. The committee has taken a consistent approach of not becoming involved in issues relating to individual hospitals, but I am aware that the Minister was due to meet either yesterday or today on that issue. So if we could maybe write back and seek clarification from the Department as to an update on that work.
But I think, Chair, this is an important issue. I was up last night in Bush Mills at a very well-packed meeting, and of course that meeting reflected the shock and outrage of the local community that such a service would be withdrawn. And we're getting meetings like that one in Bush Mills last night, and it had cross-party support in communities all around Northern Ireland, and Gordon Dunn has reflected on it. I think Mickey and Paula and you, Rosalie, have all reflected on the extent of these cuts. Now, what are we as a committee doing? You know, I'm worried that these cuts are being implemented to a bottom line without any consistency, without any focus on transforming your care, with little impact thought about, it appears to me, about how one cut would impact on another. And while we've deferred the issue of the unscheduled care, you know, there are issues in there, say, where waiting times have been reduced in some trusts, but they're piling up on the Belfast Trust. Yeah. And my worry is that, in fact, we're going to get that replicated, and we haven't even got. So you can see where I'm going. I think we need to have some evidence session which reflects the issues. Well, singularly, of course, Dalriada is important. These cuts are impacting on communities like Northampton, and it appears to be with no consistency to a plan.
We have requested, and they have agreed to an evidence session with the department next week, which is the 26th, is that correct? On the budget and how that's been, the proposals around the budget, and I think those conversations need to take place at that.
Yeah, Chair, just to follow on from that, I mean, that's the Dalriada, and that's the MS provision, is that right? I was astounded whenever the Minister said, I think there was only 69 people used that out of a total of well over 1,000 in Northern Ireland. Is there a lack of awareness?
It certainly was reflected at the meeting last night that there may be questions over how people were being advised of the availability of that service. Yeah.
Okay, thank you for
what are we doing, Chair, then, with this?
Well, what we're saying in the general context of the proposed cuts and the budgetary implications, that there's an evidence session arranged for next week. We're also writing back to Moyle District Council on that. And we're seeking an update from the department and the engagement that the Ministers have directly on it.
Yeah.
Okay.
The other thing we've done in old time is have an informal meeting.
The only thing I would suggest around that is there will be one scheduled within the next month, 2 months.
Yeah, but
the series of.
But I mean, what's happened here is when the Minister yesterday was telling the House that he had not yet made a decision, the staff were being told it's shut from next week, and in fact staff would be moved out. So, I mean, there needs to be good faith around this, and this business of a trust doing something that the Minister doesn't know about yet. The department may be asking the trust to make the cuts. I mean, it's
certainly the policy direction is from the department would suggest that it is about protection of frontline services, and yet the reversal seems to be delivered.
And it's not done. I mean, the one thing I keep banging on about at this committee and others is transparency and accountability, and that is nowhere to be seen in these processes.
And I mean, it's like deja vu when we go back to the residential homes and what the Northern Trust did then. It is completely, and I thought they would have learnt their lesson from then about the uproar of going ahead and making decisions that hadn't been finalised. And they did it then, and they're doing it again. And they did it way back when I was working for the Trust under the last mandate, and closed wards within a week and 2 weeks in hospitals. So I think really after the last debacle for the residential home, really they should add a bit more sense over this.
Well, what I'm suggesting here is we go back to the department to ask for an update on what the department and the minister's doing specifically on this issue, but that the wider issue in terms of what the delivery of proposed cuts throughout the various trust areas and the implications that that has in terms of transforming your care as part of the budgetary discussions next week. I would also say, I mean, individual members can convene, I think Kieran had done it in the past, a meeting with any organisation and invite MLAs from the committee along. That's what they're getting to do as well.
Really.
Okay.
There's a motion on that coming up anyway.
Next week as well, there's a motion.
Next Tuesday, so I mean, obviously the minister's going to have to give some.
Okay. Members, page 205 is correspondence from the Patient and Client Council seeking an extension in relation to the progress report on the implementation of its access to GP service recommendations. I'm asking members, are you content to grant the extension to mid-January?
Yeah, right.
Page 206 is correspondence from Time to Change, seeking the committee sponsorship of a minimum unit pricing event on the 19th of January. Content to sponsor?
Great, yes. Sooner the better.
Yes. 207 is correspondence from the Omnibus project, asking to be included in the next committee stakeholder event.
Great.
Agreed. 209 is correspondence from Ms Watt regarding the Sir Liam Donaldson review of governance, seeking agreement to forward the correspondence to the department for a direct response to Ms Watt.
Great.
Seeking agreement to note on this. Mickey, had you...
Yeah, just the last letter there is from Mr McGinley in my constituency. There's been an issue around the neck surgery for a long time. A new one is to be built, which everybody apparently had agreed with. The reason I'm raising it, and I know it's a constituency issue, because I understood it was the Southern Trust had some responsibility. Been in touch with the Chief Executive and she's informed me that it's actually the board. And the board has been involved in meetings. This has been going on. People are using porta cabins. There's no access for disabled people. This surgery's sort of started and nothing's happened. So I'm just wondering, is it possible for the committee to write to the board and ask them for an update?
Because I think it was only copied to yourself, so it was actually formally sent to you.
Yeah.
So in that regard, what would be the process?
But it was to raise at the committee because he had written to me in my capacity as a member of the Health Committee.
I'm just being advised by the clerk it would be inappropriate to write to the board on a constituency issue.
But that's okay, I just wanted to clarify.
Okay.
I have no problem with that.
Thank you. Okay, the next item, which is item 16, is any other business. Do members have any other business?
Yes. Chair, if it's okay, I just wanted to raise an issue about comments that Mr Dunn made about me on a BBC website, and I mean, he's entitled to express opinions, but he made a statement that wasn't true, and it related to this committee, so I just think it's appropriate to raise it here, because it was on the 29th of October. What you said was in your statement that I had stayed silent for an entire meeting, and Hansard will show that that's not true. So I would like you to retract that statement. You can check it out with Hansard and check your press statement, but it's, as I say, you're entitled to make your opinions, and your opinions are your own, but it's an untrue statement.
Yeah, the point's been made. So it's just raised formally.
I'll check it out.
Check it out. Okay.
A couple of items, Chair. Since our last meeting, there has been a report about the ever-increasing incidence of autism throughout Northern Ireland. I'm sure members would have known about it, which is very worrying. And also, as a member of the all-party group on autism, we had a meeting this week, and we had representatives from a group in West Belfast called Shine, and they are very concerned about the lack of autism facilities for the area. And of course, I think that applies to all areas. Would it be possible for the committee to write to the board or even the minister on the autism increasing and the lack of facilities for families with autism, particularly the Belfast Trust?
Well, we've just dealt with a similar issue where I've turned down the process around the committee writing to the board on an individual issue. I think I'm suggesting, Kieran, that the way of dealing with it would be the all-party grouping would take up the issue, or this committee could reflect on engagement with that group, maybe at the next stakeholder engagement.
I mean, I hear what you're saying, but it's not a constituency issue. It's a Northern Ireland-wide issue. The increase in autism. What's going on? You know, what's going on? Nobody's doing anything about it. That's the first instance, and then the other is the lack of facilities. And while this is increasing, there will be an ever-increasing lack of facilities for families who can't even get a diagnostic report or result.
Has the All Party Group taken this up with the department?
No.
Okay. Well, could I suggest that happens first, and if there is an issue then around the increased levels and any issues around service provision or access, that this committee could reflect on it at that point. But I think what we would need to get, Kieran, is detail from the department first of all, and I think the All Party Group would be the vehicle to use there.
Well,
and we can certainly reflect on the department's findings then.
Right, okay. The second one is to remind members, as members of all parties on the table, that the 30th of November is the deadline for responding to the consultation on the Independent Living Fund. And I would encourage everyone, all of the parties, to respond to that, and preferably option 2, because it's an Independent Living Fund users group who's had meetings all along, and they're going for option 2. So if members could do that, it would strengthen the case for the Independent Living Fund to carry on as it is, only on our different guys. The Scottish people, for instance, they have introduced a Scottish Independent Living Fund but seen no restrictions. In fact, they've invested further for people outside of that. So
I appreciate you raising that. I mean, we certainly have responded.
What was that?
30th of this month.
November.
There was actually a court case in Britain which the people won for the Independent Living Fund users, and the government then just changed the rules. That's what's been happening. So the court case was actually successful. They got a fair bit of publicity around it. Because the Independent Living Fund, for those people who use it, is a very useful tool. Very useful tool.
Absolutely.
Okay, I appreciate you raising that and bringing it to your attention. Members, the next committee is Wednesday, 26th of November at 2 o'clock here in the Senate chamber. Thank you.